In McMinnville. I finally got the upstairs outside of my windows cleaned, which is like a major life accomplishment for me. So it's a very tall ladder and a squeegee.
Victoria, I was not far from you. I was up at Timothy Lake on Sunday, so hung out with some friends and three dogs and a couple of young kids and played around in the lake a little bit.
We were also at Timothy Lake on Sunday, so I wonder if we cross paths.
If you heard the high-pitched bark of a 6-month-old, 19 different type of mixed breed dog, then we were not far from.
That's fun.
And Mary Gillen took her 3-month-old son on his first camping trip. That's exciting.
I spent my last weekend in Lisbon and it was wonderful, beautiful. It was the best vacation ever.
And
Nice.
Christy and Allison saw each other in person. That's exciting in Manzanita.
And welcome back, Mary. And yeah, that's brave taking a 3-year-old on or a 3-month-old on a camping trip. That's pretty bold.
If you do it while they're young, they just don't know the difference. Where my buttons have moved. I'm trying to see how many council members are here. I can't find the list. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Fourteen, 15, 16, 17. We have quorum chairs.
Well, I will let Annette kick us off.
All right. Welcome to the September System of Care Advisory Council. I'm Annette Matricotomy, co-chair of the council, representing family and those families impacted by juvenile justice.
All right, can't get my mouse to where it needs to go. There you go.
Thank you. Welcome. And our agenda today is Youth and Family Partnership Review, merger between Albertina Kerr and Exceed, discuss and vote on whether to approve the 2024 legislative report, hear public comment, committee updates, strategic planning discussion, engagement opportunities, and at the end, we'll have housekeeping and announcements. Over to Adam to do the roll call.
Yeah, sorry, looking for the unmute. I'm having a little struggle here. So cool. Well, we'll start with Allison Stark and Sonia Little Deer Evans.
Allison Stark's here. This is Sonia here.
Jackie Serrano and Sandra Santos.
I'm here. Jackie's here.
Sandra Santos, I'm here. Good to see everyone.
Dr. Robin Henderson and Anderson Dubois.
This is Robin. I'm here.
Not seeing Anderson quite yet. Dr. Kyle Johnson and Adam Peterson.
Yeah, Kyle Johnson, I'm here.
Adam Peterson here.
Judge Marisa Gates and Jesus Nunez Pineda. Not seeing others.
Jesus is excused from today's meeting.
Okay.
Thank
cool.
you.
Thanks, Julie. We got a lot of doctors on this crew. Dr. Grace Bullock and Emily Cooper.
I'm a Juris Doctor.
Sorry, I did not mean to exclude you.
No,
Just not the typical intro for you attorney folks.
no, it's so annoying when people do it too. Anyway, Emily Cooper, she, her, and I represent Disability Rights Oregon.
Thank you very much, Coop. Dan Toma and Cindy Cecil.
Hello, Dan Toma, he, him, and I am here.
Cindy's here.
Dr. Krista Cousins and April Point Gerner.
Kristen's here.
We're here.
We'll have Annette say hi again, but Annette Matchcotomy and Dana Hiddle.
Dana Hiddle's here.
And maybe Annette doesn't want to say hi again, so she'll have plenty of time to talk later. Andrew Grover and Amy Baker.
Andrew's here. Hello.
Not seeing Amy quite yet. Alicia Overstreet.
I'm here.
And that leaves me. Adam Rodakowski. I am here as well.
Adam, just quickly, Jill Archer is also here. We haven't gotten the formal appointment from the governor's office that she will be taking the CCO seat that is open, but that recommendation has been submitted and Jill's here to watch the meeting, and so she won't be voting until we hear directly from the governor's office as to whether they've done the appointment or not, but I wanted you all to know. Jill's in the room and she's the expected person to take that CCO seat. So Jill, I don't know if there's anything quickly that you would want to say, but I'll put you on the spot in case there is. And no thank you is an appropriate answer as well.
I don't really think I have much to say. Just thank you for the opportunity. I hope that I get appointed, but have a long history of working in the kids system of care. So excited to be here.
We're looking forward to having you, Jill. So, and I have no doubt that next month you will be probably an official member, and we'll go from there. Am I up for group agreements as well? Sorry, I'm juggling 3 screens.
Yep, group agreements, and then we'll go back to Annette for the GARE reminder.
Cool. So family and youth, just so everybody knows, if you're showing up here as a family member or a youth or young person that has been involved in our Oregon system of care, which if you're a youth in Oregon, you have, you're welcome to participate in the meeting at any time. If you're a member of the public who are not youth or family members, please hold comment for the public comment period, and you can, of course, contribute in the chat. If you don't want to speak publicly, but would like to share your opinion and have it heard, you can send a private chat to Joylene, Alicia, or Annette, and they will say that comment without attaching your name to it. So want to make sure that we've got room for folks to express themselves however they would prefer. Group agreements: be present and participate. Practice respect, avoid interrupting, and use folks' names and pronouns that folks introduce themselves with. Avoid acronyms. Use the chat to write definitions or ask for clarification. Sometimes, we all use acronyms, and so let's just call each other in and make sure we're explaining those. There's going to be difference of opinion in this meeting, so varied and opposing ideas are welcome. We can challenge each other's ideas. It doesn't mean we can challenge people. Let's be respectful. Honor those with quieter voices. Feel free to lean in or lean back. We're not going to problem solve individual cases and solutions here. If you do have one of those that you want support with, somebody and a couple of people probably in this room are going to be very knowledgeable and will be happy to help you offline. And so we can definitely address those. Let's just not do that here in this setting. Our focus, of course, is on improving the system of care for Oregon, for young folks and their families. If you're a person who holds some power, just be thoughtful about the power dynamics in the room and the privilege that you might hold as a result. And then, of course, while admiring the problem is something that is easy and frequently done, we are here for solutions and to make improvements. So let's try and stay as focused on those as we can. That's not ignoring that we have issues, but it's that we want to get to solve those things.
Oops, I forgot to put the GARE slide back in. Annette, do you want to review that portion of the agenda anyway, or would you rather have me skip it? What's your preference? And I apologize for messing it up. You were muted when you answered. I apologize.
Yeah, I'd like to review it.
Okay. Do you want to just say it out from the presenter's agenda?
Yeah.
Okay.
I will. Let's see. GARE reminder. As a reminder, the SOCAC is using the GARE tool to ensure we consider racial disproportionality in all of our decisions. GARE stands for the Government Accountability for Racial Equity. It requires us to ask the following questions every time we make a decision on policy, program, or budget. One is, what are the racial equity impacts of this particular decision? Who will benefit from or be burdened by this decision? Are the strategies to mitigate any unintended consequences? Are there strategies to mitigate any unintended consequences? And is completion of the full racial equity worksheet warranted? You will see these questions have been added to our consensus process slides to direct our attention to racial equity as we formally make decisions together. Thank you.
Thanks, Annette. And now quickly, a quick pivot. One, I want to create some space for Cody Welty to introduce himself, and he'll describe his role with the council. And then two, I messed up on the timing. Turns out we can't both have Joylene and Allison presenting at the same time. So we're going to do a quick, Joylene's going to tell us what she's going to bring to the council next time in a minute or two, and then we'll transition over to Allison. So I apologize for that. But first, Cody, welcome.
Everybody, thank you for having me. It's really good to join in on these meetings. And thank you for the introduction, Anna. My name is Cody Welty. I use he, him pronouns, and I just started at Oregon Health Authority as a research analyst, primarily assigned to the system of care. Just a little bit about my career path and what I'll be doing. I'll keep it rather brief because I know there's a lot on the agenda. I went to high school here in Oregon in Sandy, and I was involved in the mental health system when I was an adolescent there. Following that, I earned an undergraduate degree in psychology at Western Oregon, and I did a lot of work in suicide prevention advocacy during that time, including a lot of post-suicide work with school systems after deaths by suicide, where I worked with youth to help answer their questions and worked with school administrations to help ensure adherence to best practices following a death by suicide in communities. I left Oregon for graduate school in Arizona, where I studied adolescent suicide and substance use, and I earned a Master of Science in Public Health, followed by my PhD in adolescent health in the public health sphere. What I'm hoping to accomplish with this background and my role in this committee is to help translate some of the data science from Oregon Health Authority over to this group in a format that makes sense. Data can be very unwieldy and confusing and complicated. And it can help to have somebody help translate that. And I'm hoping that's what my role will be here, to help support everybody's ideas and try to bring a numbers focus of that and help bring those data and analytics skills over to the group from OHA. So thank you everybody for having me. I'm really excited to listen to everybody and to learn from you all.
Thanks so much, Cody. Welcome. We're glad you're here. And now we're skipping this part. Joylene was going to tell us about a new model for youth-adult partnership that was sort of co-created. Preview of the slides that we'll dig into. Feel free on this slide here to look at it. It is in your board packet. We'd love for you to think and feel about what this might mean if we use this as our model for youth and family engagement. And that's all for now. Joylene can cycle back to it during the committee updates. And Annette, it is on your presenter's agenda to introduce Allison for her portion.
Thank you. We're going to talk about the Albertina Kerr and Exceed merger. Allison Stark, System of Care Advisory Council member and CEO of Albertina Kerr, is here to describe the recent merger of Albertina Kerr and Exceed and describe their model for a continuum of care for people with IDD and mental health needs. We'll finish with a conversation about this model and how it can inform our system integrations. Welcome, Allison.
Great, thanks for having me. When Anna asked me to present on this, I thought it would be good to kind of start with context setting and then share a little bit about what Albertina Kerr is doing. So I'm hoping I can share my screen. I can. So just a little bit about me for those of you who don't know me. My name is Allison Stark. I've been at Albertina Kerr now for a little over 2 years. Can everyone see my screen?
Yes.
Great. Before this, I was the state director for developmental disabilities in the state of Illinois, and prior to that, I operated a nonprofit very similar to Albertina Kerr in the Chicagoland area. I've spent my entire career working with people with intellectual and developmental disabilities and mental health challenges. So just to kind of set us off on the right foot, I wanted to talk a little bit about the social model of disability versus the medical model, because I think this is really important when we're talking about the services that Kerr provides. The medical model approaches disability as something that's an aberration or something that's wrong with someone compared to, quote, normal traits or characteristics. And it kind of sees disability as something that needs to be fixed or rehabilitated. And that's in opposition to the social model, which approaches disability kind of in the framework of the broader culture. Because we live in an ableist society that makes things harder for people with disabilities, the social model is important to understand because in a lot of ways, many people with intellectual and developmental disabilities or just physical disabilities ultimately kind of embrace the disability, identity and see it more as an identity, just like your race or your ethnicity or your gender, that it is part of kind of who they are. And the idea is that you are not, fixing someone's disability. You're understanding of how disability interacts with the broader culture and environment. And really you work towards changing the ableist society and creating inclusion as opposed to fixing or focusing on fixing the individual. And this kind of goes along, I know many people have probably seen person first language versus identity first language. Obviously, I'm not here to say which one is better, and this really comes down to the individual you're talking to. I tend to start with person first language just because I think it's respectful until I hear otherwise. But I think that the idea of person first language is that you're emphasizing someone's personhood, as opposed to identity first language is really emphasizing that kind of identity piece that I was talking about earlier. So you have some people that are like, I'm autistic. Like, I don't want to be a person with autism. I want to be recognized as being autistic. Again, this is the preferences of the individuals themselves or broader communities. This is not for me or any of us to necessarily say what is more preferable, but I think it's an interesting point and something that I like to bring up. Person-centeredness is another key focus of what we do at Kerr, but I think also is in the broader support community when we think about supporting people with disabilities and mental health challenges, which is that person is the one that's in control of their services and the supports that they need. So the idea is that we presume competence, we presume people understand what they need in their lives, and we give them options. Let them direct their services. We value the contributions, and really we look at kind of all the system that's around the person, both their kind of, if they have paid supports, if they don't have paid supports, but also the natural supports that allows them to live kind of a self-determined life. And then dual diagnosis is something that we, I guess, talk a lot about here at Kerr, because we do serve and support a number of people who have both a developmental disability diagnosis, but also a mental health condition of some description. And so, I'm using mental health condition. Mental health is really kind of the internal experience or your kind of mental and feelings and how you feel in the world, as opposed to behavioral health, which I think is more of kind of how you externalize or have those, kind of interact in the world. I think that, it says here, National Association of Dual Diagnosis, which, does say that they think about 35% of people with IDD also experience mental health challenges. In my professional experience, I think it's actually higher than that. And one of the things we often talk about at KER is what is a mental health challenge and what is just a developmental disability, because you don't want to treat a person with autism, as if they have, even if they have what some people would say was inappropriate behaviors or some other types of things. You wouldn't want to treat that as a mental health diagnosis if that's part of who they are. And so I think separating out what is a mental health diagnosis, what is a disability or part of a developmental disability diagnosis is really key and really important to have staff that are really thoughtful and trained to do that. In addition, you wouldn't want to medicate someone, for example, if it's just part of a developmental disability or some other, challenge. So KER's mission is to empower people with IDD and mental health challenges to lead self-determined lives in their communities. And we did, I'm just jumping all around. There we go. We merged with Exceed Enterprises on August 1st. I think something that many of our my nonprofit friends can sympathize with is that there's not a lot of money in the system, and you're really having to make do in a lot of ways with less. That's particularly true in the IDD service system. We haven't received any increases in the last 2 years for residential services. And it makes it very challenging to operate in this environment. And so one of the opportunities we saw was an opportunity to merge with another organization so that we were essentially growing our revenue base. Both of our organizations provide the same or complementary programs, and I'll get into that in a moment. Our combined size now serves about 30% more people. Being a larger provider amplifies our ability to be impactful with the legislature and with our advocacy efforts. And then obviously the efficiency piece, which is what I was talking about a moment ago, which is we really need to grow program revenue, which reduces the administrative, overhead or burden for the organization through the additional revenue that we're bringing in through these programs. So this is KER's array of services now. The white are kind of our current KER services. The green are what we did before, but now it's bigger. So we actually doubled the size of our job development, placement, and support for people with disabilities. And then the blue is kind of new KER services. So KER used to provide some day support for individuals. We got out of that business several years ago, and now we will be providing that again. We have, obviously the merger with Exceed is really focused on kind of our job development piece and employment piece. Competitive integrated employment is really the goal. KER's services tend to be more focused on a bigger portion of our services tend to be on the residential services, which we have 12 youth group homes for kids with pretty complex needs. We have 29 homes for adults with disabilities, and then we have our subacute crisis psychiatric support for youth. So that was all I had to share today. I'm happy to take questions, talk further about anything.
Well, maybe if you want to pull down your slideshow, and then so the intent was to really look at this merger and how it kind of demonstrates bringing some services back, providing services in home, in community, right, and sort of in one place, an example of the continuum of care that lots of folks have been talking about. So questions, ideas, I don't know, just wanted to give you all a chance to think about it in that context and what we may learn from this experience as Allison and her team walk through it.
So I see there's a question in the chat, which was the ages served. It kind of depends on the program. I think our young youth residential placement is 9, I want to say, but we have 9 to 18 in our youth group homes. In our subacute crisis psychiatric unit, these are short stays. These are not just for kids with developmental disabilities and mental health. These are just kids facing any mental health challenge. Right now, I think we haven't had littles in about a month or two. So littles are 5 or 6, but we have had 5 or 6-year-olds in the past. The average age, though, what I would say is 12 to 13, 14, somewhere in that area, but we get the broad range. And then through adulthood, so some of our older adults with disabilities are in their 70s. Emily, I'm calling on people, sorry.
Awesome.
Have at it.
Thank you, Allison. And I don't know if you saw in the chat, I love you describing the different models of disability because of some of the bias. So thank you for that. Shows your experience with this community. My main question is this. I mean, we're the System of Care Advisory Council. And so while I have high regard for ODDS and the work y'all do, what should the process look like if a youth is, say, in school, so ODE is implicated, or in detention, so OIA, or it's a foster youth, so it's ODHS, or it's a K-plan kid, so it's OHA. Like, what is the process for identifying youth who are eligible for your services? I know ODDS is a different entity, and I don't expect you to go there, but what's the right way? I'm assuming it's assessment, but what does that look like? So if there is a youth in these systems, how do the systems talk to each other so that you get the right referrals?
Yeah, so, I think KER is somewhat unique because we actually fund all of our youth group homes through ODDS. So we're getting kids that are IDD plus, they're just more complex than that because they need an out-of-home placement. And unfortunately, KER also gets those kids that if they don't do well in our program, these are temp lodging kids, unfortunately. So these are complex. These are complex cases. We do braiding of services. So because we're also a mental health organization and we have our crisis psychiatric unit, we also have an outpatient therapy team that actually works directly with the youth in our group homes. And we bill all of that through the CCOs or private health insurance if the kid happens to have it, which they usually don't. And so we're braiding services. So we're taking ODDS funding for the group home setting, and then we're braiding that with the mental health services that are provided to the youth. This is pretty unusual because most IDD organizations don't have, contracts with the CCOs and vice versa, right? What I would say is they are two very different systems that don't often work super well together, not because they don't try, they do, but it's just, I think because it's really hard because as soon as you fund something through different mechanisms, I feel like that's almost part of it. Like, right now, I think we have contract, we do fee for service through the counties, ODDS, we have CCOs, we have some things that are funded directly through OHA, and we have, we have all of these different requirements based on that regulatory environment. I think the biggest example of the frustration I have with the system is that we've got kids in our youth group homes that when they are turning 18, they have to move to adult services. But they are transition age youth and are entitled to educate. I know, you know this. They're entitled to into their transition, their transition schooling. Oftentimes, there's not an adult placement in the exact same school district. So we are upending these kids' lives and we are moving them to the adult system. And oftentimes they just decide they're going to just leave school altogether and not get what they're entitled to. And so I think it's an example of systems just not communicating really well, because I don't think anyone that works for the state would develop a system that does that. But that's the system that we have, because we don't, it's like we aren't thinking about the complexity of operationalizing it. And so then you end up with things like that.
Yeah, I think this is a great thing to flag, because I think, part of our role, our charge is to advise the governor around, what are the gaps and how to address them. And I think this is a good one to have on our list, Anna, because, some school districts will do tutoring or will allow for out-of-district placement, but there just needs to be that communication and that coordination And, I think ODE's guidance could be good here, but so could, something legislatively. But Allison, honestly, I could talk to you all day, but it'd be curious to know if there are other big system issues that you wanted to flag for us to think about.
I think for me, I think that the disability piece is just not talked about very much. And I think it's an important piece, kind of because of that diagnostic kind of thing that we've talked about. Do you know what I'm saying? Like, I recently met with a group that does brain injury awareness, and one of the things that they're really interested in is figuring out how the youth system is impacted by undiagnosed brain injuries, right? And I just think so much so much of how we handle cases is built on fixing and rehabilitating. And I think what the IDD system brings is this kind of acceptance of that there is a range of normal behavior and living, and that it's okay, difference is okay, and really leans in on that. And I think sometimes we can kind of focus on like how many beds do we have, how many psychiatric beds do we have, and how much like this kind of this intensive models, as opposed to also kind of thinking about when is something you need to fix? I guess when do you need to fix something? And is it based on how I feel like I'm operating, or is it how you, and I'm saying you as in someone external to me, saying I'm operating in a bad or maladaptive way? So, but I could come up with other ideas, and I'm happy to talk offline about those.
And then Allison, Cindy asked, can any organization refer, for instance, Yellow Hawk? Or does it need to be a hospital emergency department or community mental health agency to get access to CUR services?
So for our subacute program, I believe we do take community-based referrals, so they don't have to come directly from an ED or a hospital. And we do have, but you would need, I believe you do need a psychiatrist to sign off saying that they need a secure facility. I think one of the great things about our subacute program is that we're pretty good about 2 to 3 weeks for getting kids back out with supports and it's really about the transition. It's about assessment, stabilization, and then getting them out as quickly as possible in their home community with services, because we know the longer a kid is in, kind of a secure setting, it can be really challenging to transition back home.
Cindy also wants a copy of your slides, Allison.
Oh, good.
I'm super excited because we're so limited on subacute and acute facilities. We know, like nationwide, and especially Oregon being so rural. I've got my list going of agencies, so it's great to be able to add you guys onto that list. So thank you for that.
And yes, we do the case management or assistance with setting up services post their stay, because that's the key part. Like, it all falls apart if the person goes home and doesn't have medication management, if they were put on medication, or doesn't have a therapist, or, those kinds of things, which can be really hard when we're discharging back to rural communities. Just, I want to say, we haven't broken the code, but that's part of our job, is to make sure there is a continuity. And I'm happy to share my slides with whoever wants them. It probably is easiest just to send them to Anna, and then she sends them out, just so I don't have to keep track, but happy to share them.
I guess I have a quick question. So with some of the work that the council is doing in regards to workforce development and identifying, ways to improve workforce within the mental health and behavioral health area, do you think that this merger actually helps with creating a more stable workforce for individuals and their families navigating IDD or experiencing IDD and or mental health challenges?
Yeah. What I would say is that, this merger really was focused more on our employment services, which kind of bolstered that side of things. generally speaking, we don't have the same level, I'll just be honest, of turnover in that work for some reason. It's probably because it's more always soul enriching to help people find jobs, right? You might be overcoming some barriers, but generally speaking, I think there's a lot to that work that's really appealing to folks. I think where we see most of the challenges in workforce is obviously in our residential settings. That's actually where we see it the most. And I think that it can be it's hard work, it can be kind of isolating. And so we see it the most there. I think for me, where the merger makes sense is, again, you become a larger organization, and the amount of your overhead, so like the cost of me, there's not a me now at Exceed Enterprises. So that money can go to increasing wages. That money can go into, you have the value of size and scale. And I hate to say it because I worked for a scrappy nonprofit for many years, and I was little and we were mighty and we were a great organization. But it can be really challenging in environments that don't see regular increases or don't pay a living wage to the staff that work in your residential communities, and you're already paying, $2 or $3 more an hour than you're reimbursed from the state. You've got to find places for efficiencies. And so that's where, this merger really allows us to, reinvest other dollars. Instead of 2 case management systems, we can have 1, and it's not more expensive. It's less expensive to have a bigger organization use 1, some health record than it would be to have 2 organizations doing it. Do you know what I'm saying? So it's like, that's really where the savings come in, so that we can then direct that more broadly, which is what our goal is.
I appreciate that.
Yeah.
Dr. Cousins is wondering if you offer telemental health services after discharge.
We do not, and partly because just like many of you on this call, I'm sure, finding psychiatrists and maintaining them is very hard. And so our psychiatrists have enough capacity to focus on the internal, like the operations of our subacute facility, as well as they do all the medication management for the youth that are in our residential homes. So the reality is, we don't have any excess capacity to be able to serve, kids that are in, rural settings, because we can barely get the amount of support that we need to serve the people we currently serve.
As a follow-up to that question, you mentioned that you're struggling with finding psychiatrists, which is, totally get it, because psychiatrists tend to get paid just about as much as a PCP does, and it requires a lot more education. Now, I wonder if nurse practitioners or psychiatric nurse practitioners or psychiatric physician's assistants would be able to, yes, PCP, I'm sorry, primary care physician. If those would be alternative or good alternatives who could work under a psychiatrist. I don't know, do you have any experience with that, or is that more of a kind of a bureaucratic burden where there are rules against it?
There are rules against it in the subacute facility. So we cannot use a psych NP in that location. We could use a psych NP to work with our youth residents. I'm a big fan of psych NPs myself. I think it's really hard to make more psychiatrists. We had to move somebody from Michigan. I think we have 3 full-time psychiatrists now, and our 3rd just joined the team from out of state. It also depends on the psychiatrist, because some psychiatrists don't love psych NPs and don't feel that they're as strong. And so I will be honest, I also have to defer to my workforce that I currently have and what they're willing to do. And to date, they have been a little resistant to psych NPs.
Okay. Maybe another conversation that we need to take offline. I would love to get some more info on that.
Definitely.
Any last questions for Alice?
Great. Well, thank you for letting me present today. Appreciate it.
Yeah, and congratulations on the merger, and we're excited, I think, for those savings to flow back towards, like you said, increased wages for staff and better services for kids and families and all of those things. And so yeah, it's an interesting concept around the merging of smaller, not that Kerr was small previously, but like smaller nonprofits into larger nonprofits and the savings that can provide and pass back down into the folks that we're here to serve. So appreciate you sharing the details and chatting with us a little bit today. So next up, we have Robin Henderson and the 2024 legislative report. Robin, I'll turn it over to you.
Thank you so much. I'm so excited.
Can I do
you hear me?
Before I turn it over to you, Robin, actually? So I just want to remind people the work on this legislative report has been done. So let's not get into wordsmithing. Like, I'm just going to throw Robin some cover here on this one before we get started. Like, if you want to wordsmith in the future, we have a legislative committee. Robin can give the plug for when and the frequency of those meetings, and you can wordsmith to your heart's content. So now I'll turn it over to you, Robin.
Oh, Adam, I'll take that cover any day, because thank you for saying what is top of mind for me, which is what we're looking for in here is the direction and not necessarily the verbiage. If there is some specific verbiage that you find is highly problematic or something like that, please just shoot me an email. I mean, me or Anna an email. We've looked at this thing 1,000 times. Maybe we've missed something and said something that's completely like on another planet. And if we've done that, shoot us an email and we'll see what it is that we can do. We did review this report in detail with the Ledge Committee and talked about the concepts for some time. And basically, we also sent it out to you all on Friday. So I know you've all already read it. So what I'd like to do is to go through the report. And if you have questions, I think I can see if you raise your hand, or you can put them in the chat, and we'll just keep an eye out. This first section here is our just general explanation of who SOCAC is. This goes to the legislature. We do this report every year. And this is our annual opportunity to share with the legislature why we're great, fantastic, wonderful, and all the other good things. So this report goes from August of 23 to August of 24. The next section, as we get into the next session, talks about our recommendations for legislative action. And what we did throughout the report was to try and pull out some bold things. One of the great pieces of feedback we got from the Ledge Committee was that we needed to make sure that we didn't bury the lead. So we rearranged the report and put our recommendations for legislative action right up front so that people would know right up front what it is that we're recommending. We wanted to make the case here, and that's what we do in these paragraphs, is to talk about why it is that we have these recommendations. We all know that Oregon ranks last or almost last in the nation for access to children and youth behavioral health services. That's not a surprise to anybody in the room. So we want to see how, and our encouragement goes along in here, that in that poll quote, research strongly indicates most youth strive when services and supports they need are available in their home community. But the bottom line up front, as they say, is that our priority recommendation is that there should be funding for system stabilization. We know that a lot of things have been funded recently that were not fully funded, that have not been fully implemented. And rather than bringing anything new to the table, SOCAC would like to recommend, and this is our strong recommendation, that we stabilize the system by fully funding the initiatives we're going to go through here in the next section. Scroll on up there. First thing that we have in our evidence-based services and support, the early and periodic screening, diagnosis, and treatment. It's an Oregon Health Plan benefit that requires all OHP members up to the age of 21 age-appropriate medical exams, screenings, and diagnostic services, and treatment. We want to ensure that children and youth are diagnosed and treated as early as possible because we know that reduces acuity across the system. We want OHA to require CCOs to ensure all of these assessments and supports identified are provided regardless of whether providers exist in network or not. We've heard from a lot of families and a lot of youth and a lot of parents that you've got this assessment, you've got this recommendation for care, and the care's not there because it's not in network. That shouldn't be a thing. You should be able to access the care you need regardless of whether it's in network with that particular CCO. Do we have any concerns about that initial recommendation? If not, let's keep going. The second recommendation comes along for BRS services. We had a very robust conversation about BRS services. People have a lot of opinions in this space. We call it BRS because that's what Medicaid pays for. So we don't want to relitigate the issue of BRS, but we do want to bring up that BRS should be available to any OHP child or youth for whom it's clinically appropriate with funding through the Oregon legislature. This would allow lower acuity children to get these services in their homes and communities, preventing them from having to have law enforcement or child welfare. Those services are only available. We also want to highlight, and Adam did a great job of educating. I know I didn't realize a lot of this stuff about the focus on collaborative problem solving and addressing, how we use collaborative problem solving in these settings. Adam, you've got your hand up, and I see Jill's got a question in the chat. My hunch is it's probably the same question.
It is not, although I will second Jill's question too. My question would be, I think also highlighting a centralized referral process for BRS referrals to make it accessible so that it's not having to go through each individual BRS provider. I don't know if that's up to or within scope of our legislative thing, but I think it would be hugely important.
That's a great call out, Adam. Thank you very much. I like that idea of having some type of centralized referral so that people aren't having to always look for that. Jill's question in here, is this intent that it be done via ODHS and OIA or through OHA or the CCOs? Anna, what's our intent in this one?
The conversation has been that OHA is kind of like ready for BRS for all through OHA or the CCO structure, but for the appropriate funding and sort of administrative support. So looking at opening it up so that you don't have to get a child welfare or a youth authority case opened in order to get, especially like BRS at home, right? So we can get those services into folks' homes and support them before they get involved in what we've referred to as like a restrictive service, right? So child welfare or youth authority. So that's not coming through in this little blurb. We can, Robin and I workshop it to make sure it's clear that this is intended to be a pre-child welfare or youth authority access. So through CCOs or OHA. I see nods. Okay.
I think that would help just to make that clarification.
We could do that. I also see Sandra's got a note in here, reminder that BRS equals behavior rehabilitation services, not behavioral. No one's caught that yet, Sandra. Thank you. So we need to take that AL out of there, which we will make a note of that in our document. And I'm trusting you're capturing all these little notes, right? God love you. Thank you so much. Anything else on behavior rehabilitation services before we move on to the next section? Moving into IABHT, IABHT stands for Intensive In-Home Behavioral Health Treatment. It's a program of OHA. It is in the home, and if we scroll down just a little bit more, you'll get to our recommendation down here. Basically, the legislature should direct OHA to revise these rules so that we can ensure that communities of all sizes and diversities across Oregon can stand up these programs. This has been one of our problems. Some communities have struggled to start these types of programs because the rules are very prescriptive. And other places have been able to do it, and it's worked out really well. Along in there, we want to make sure that CCOs where there aren't IABHT are also working within those communities to help stand those services up. Any questions in the IIBHT space? Let's move on. MRSS. Oh, yes, Emily, go ahead.
I mean, I know this is a little bit of repetitive, but I love that this is in here because I think we've all been up on our soapbox about the failed rollout of this. But how does this overlap with EPSDT, the Early Periodic Diagnostic Testing and Treatment Services? Because part of it is then there's that federal match. And so does it make sense to call that out, that these other OHA services could also get a federal match, or they do get a federal match? I just say that because I know a big part of this is the resources needed to address the gaps. And for me, it seems to make sense to like call out to a lawmaker that it doesn't have to be state-only dollars that does this. So that's my only thing.
I wonder if in the paragraph that starts this section, and let me scroll back up in here and see, because that's a really great call out in terms of the federal match.
I just know that going into this session, budget's going to be a big deal. And so I like calling out that not only should these services already exist, but there's a funding mechanism for it.
There may be a way that we can put something in the paragraph that leads into this, where we talk about where the different types of services come from. Maybe there's a line that we can use to call out that anything that a CCO funds is matched by federal match. We can work on that.
Robin, you might need to help me with that. And then I see Dana Hiddle is mentioning that IIBHT is a federally matched plan under the state, or federally matched program under the state plan. Not sure that gets to, Emily, your point about sort of the linkage.
Yeah, I think it's but I like Robin's suggestion that you go up ahead, that this should be part of it.
Okay.
Okay.
I think if Dana, in that, put that note with the header for recommendations for legislative action, and I can circle back around. I have some ideas about where we can put that in there.
Okay, great.
In that first section.
Okay. Can I just call out that sometimes my experience has been that whenever I show up and I do some of this advocacy, that lawmakers don't know that some of these programs are actually federally matched. So it would be up to us to then make sure that they understand that some of these programs or certain programs do have a federal match.
Yeah, no, that's what we're going to do up in that paragraph before this.
Okay. Well, and I think beyond that point to Alicia, some of this is about like legislative visits and digging in and answering, legislators will not retain a lot of what they read in this report. They will scan it. They'll be like, huh, cool. Checked off the box for reading the report. Right. And so then there's also the follow-up and the education work where, April and one of her government relations folks goes around and knocks on senators' doors and see who she can explain that to, in person and via relationship. So there's a lot of follow-up necessary for that kind of message, Alicia, just to get through, we will say it, and also not sure that people will receive it in that as much as you would want them to, I guess.
Oh, good. Thank you, Adam, for addressing Dr. Cousins' question. Let's go to MRSS, the Mobile Response and Stabilization Services. This program only receives $10 million a year in funding. That's not going to cover the state of Oregon, and we already know that. We know that it needs to be fully funded, and we need to revise the rules again in the same way as we're talking about IABHT to ensure that all communities of sizes and diversities across Oregon can stand up MRSS programs, regardless of how large those communities are. Any questions, thoughts in that one? Let's move into the employment-related daycare, a program of the Department of Early Learning and Care. This program allows young children to access certified licensed childcare providers. Again, we need to increase funding for this. It's another one of those things that was great idea brought out there and then not fully funded. Questions or concerns there? The next one is the Culture of Yes bill. Another great piece of legislation that got passed, but again, was not fully funded, needs the necessary resources so that they can establish service delivery infrastructure and fund the staff to provide these services in the 25-27 budget. Legislation is only as great as it's allowed to be implemented. Any questions or thoughts there? And then I think the last one in our recommendations is the school-based services and supports. The Oregon School-Based Health Centers and the School-Based Mental Health Partnership. Again, both need to be fully funded to ensure students are able to thrive. Those are our basic recommendations, taking a look at the things that have been passed in the recent prior years and making sure that they're fully funded so that they can be fully implemented. Anything, any thoughts, questions? We can move on to the next section. The next section talks about how the council's meeting their goals. We go over, Carissa, go ahead.
Robin, you only gave like 2 seconds for me to raise my hand when you were talking about childcare. I was just curious why it seems like it's limiting to a certain population of those maybe on TANF. I can't remember. I had some concerns that it was very limiting when so many families need assistance with childcare. I didn't know if there was a thought at some point about broadening that to just a general affordable daycare throughout the state.
Yeah, I mean, so the strategy that I think we're teetering on the edge at this point of saying like fund this and fund this and fund this, where the legislators who are in a budget crunch are going to be like, haha, cute. We just don't have the money to do all of those things, right? So we're trying to really target attention on programs that exist and are successful with an evidence basis that can be expanded with increased funding and not a new thing. So, affordable daycare for all would require admin setup and, is it the Department of Early Learning and Care or somebody else who owns it? And like, right now we're just like, okay, this thing exists, it's working well, it just needs more money to scale. So please focus there while we figure out other things. So like, yes, Carissa, and now is maybe not the right time for that given what we anticipate is possible in the 25 session.
I was aiming high.
And as Adam has been saying a lot lately, we're 51st and we're trying to get to 45th. So like, it's a step forward. As much of a step it is that we don't necessarily want to take, like we're not going to get to first overnight. So how do we get to 45th?
We're 45th. All right, let's go back down to the next section. How the council's meeting their goals. This just kind of gives you an update on what we've done for the last 12 months. If you're feeling nostalgic and want to know how you've spent the first Tuesday of every month, this section is a great read with a lot of different links in it. Talks about, all the different commissions and things we've worked with, our work on the strategic plan, updating our bylaws, our data report, our respite report, our cross-agency communication tool. Also gives a little brief paragraph on the 3 pieces of legislatively mandated work that we're going to talk about in more detail a little later, because we're looking for a few great volunteers to populate some committees in case you've been bored lately. But we talk a little bit about 4151, the issues that we're having right now, being able to get contracts executed so that we can hire people to be able to help us with this work. 5204, which was the regional trainings for the drug and endangered children, and of course the initiative we have in cooperation with the Alcohol and Drug Policy Commission regarding the strategic planning for youth substance use disorder treatment. Basically, that trip down memory lane is that entire section right in there. The next section that we talk about are our barriers, our remaining service access barriers. We are working on our strategic plan, and we're going to have another update on the strategic plan later in this meeting, so we won't go into that in detail in here. But really wanting to highlight that the concerns raised in the safety work group report remain relevant, present and things that we still need to really talk about in how we can become a more trauma-informed environment. We also highlight our youth respite report, along with talking about how this was highlighted in the need for the issues raised in the Special Masters report and the 2023 Ombudsman report. And we recommend that the legislature fund respite services for children and youth, regardless of insurance type, mental health diagnosis, IDD status, or child welfare involvement. That idea that everybody needs respite at some point, regardless of the situation that you find yourself in. We also talk a little bit about some of the barriers and gaps that came out of our last legislative report and highlight that, hey, you know, we said this a year ago, we still haven't addressed it yet. Let's make sure that we focus on stabilizing, fully funding all of those services, and that we address some of the regulatory barriers that are raised within the safety worker report. We also this is where we double down on strongly recommending against establishing new programs or services in 2025 so that we can move forward in alignment together once our SOCAC strategic plan is done in 2026. The last portion of the report is a highlight pull-out box around the disparities in youth suicide rates from the 2023 Youth Suicide Intervention Plan. We recognize that this disparity requires investments in services that youth of color will engage in, because one of the things the report noted is that while suicides have decreased, the suicide numbers for youth of color have remained the same or increased. And we have a listing then of recommendations that the legislature can choose to if they have the ability to invest in this process. We wanted to pull that out and really go into detail because this is one of the solvable issues that we need to really double down into and provide some service array for, and we want the legislature to fully understand it. Basically, this is our ask, that the legislature works with our agency partners, especially ODHS and OHA, to adapt the rules and regulations to be trauma responsive, attainable by communities with different levels of resources, and accessible for youth and families before a crisis takes place. That's our message, that's our takeaway, and that's our 2024 legislative report. Any questions before we go to a vote to approve? Yes, Emily.
The only thing, and maybe this is me with my grant subcommittee hat on, but when I look at reports like this, I always look for where the youth and family engagement piece. So I think it makes sense to call out in this, like what the legislative committee did, the efforts to involve youth and family in making this report and coming up with these recommendations. Again, it's consistent with our mission, it's consistent with what we do, but I like calling out to the legislature, this isn't just a bunch of professionals, though we know what we're doing, making these recommendations. We also, this is based on youth and family involvement. And like Joylene said, I think the shout out quotes is great, but I wonder if it makes sense to sort of delineate that process so that lawmakers know this is coming from youth and families too.
I think we can, do we see that in there? Anna and I will take a look at that with that read on it.
Yeah, I think I saw, comments from youth council, but I didn't see family. And I know there was a process. And so just like delineating that, I think would be good.
We have
I mean, if we're being honest, there wasn't like much of a process.
Well, and we have a lot of family involvement on the legislative committee. There was a lot of family input. We have a lot of family input in the legislative committee itself. But yeah, I think that was one of the things this year that we didn't have quite as robust a process as we did last year.
So yeah, the family voice came in through the committee process. That's a very well attended committee for family advocates. So their voice is just in it as part of that committee space. And then the youth provided feedback and recommendations. Some of them were pulled into quotes and some of them were actually like worked into the text. Just what they were suggesting was so perfectly in alignment with what we had already written that it was like, oh, I'll just take this from Stardust and put it over here. And so they then got a chance to review it and approve how it had all been integrated. But I don't know even that it's like, I could probably go back through like version control and figure out what was added by who, but
I don't think that level of detail, just that there was a process and maybe even the candor of it wasn't as much as last year. I just say this because I've been in the Wyatt case beginning emails from lots of youth and feedback. And so, I think one thing that I've gotten in that feedback is that a real request that there be more funding to do peer work. And even a request that like as a member of the SOCAC, I talk about the value of peer work. And so I've not been part of the legislative committee. I don't know if there was that discussion of including that feedback from youth, but I just wanted to flag it.
Noted. We will take a look at that.
appreciate it.
Other pieces of feedback before we jump into vote.
The only, and it's not wordsmithing, I just wanted to make sure that in terms of the disparities in youth suicide rates, looking at the report, the annual report, it only looks at race and gender. It doesn't look at any other potential forces of impact, such as disability or socioeconomic standing. So I don't know if that's something that we can work into as we move forward, or if that's something that we can continue to call out, or if that's just adding a sentence to this, or if it's let's put a placeholder on this. And because I'm totally okay with going forward with this. I just want to, I guess, just for record, for the record, just to call it out.
I think that's feedback that we can pass along to the department that report comes out of OHA's youth suicide folks, and we can pass that along to them to say, hey, in future reports, we'd like to see you gathering a little bit more nuanced information and do it that way rather than what I don't want to do is give the legislators a reason to walk away from that recommendation. You know what I mean? But I think that's information we can pass along to OHA.
Perfect. Love
Andrew.
it.
Did you call on me?
Yep.
Okay. So I have this experience that people don't read. And so my suggestion would be that I really like the way the reformatting, I think the kind of salient points are closer to the top. But I would encourage us, without changing any of the content, to just move the recommendations into one section called recommendations. 1, 2, 3, 4. That's it. And most people will only read that, honestly. That's just my own experience. And if you don't do it, I'll still vote yes, but I would encourage that.
My experience is most people don't read these reports either, unless they're doing one of two things. They're in the wordsmithing phase that Anna and I have been in, and I'm in this on another document right now that Jill and Adam will laugh at. Now you know why I read these reports to a level of detail that I do, because somebody has to. But I appreciate that, and maybe what we can do is create a one-sheet pullout that just basically is like a one-sheet summary, like an abstract. And that abstract has the recommendations all on it, boom, right up front. And then for your reference, here's the report that your staff will read. But for you, here's the recommendations, just so you get that up front. Executive summary, is that better than abstract? You guys. All right, are we ready to vote? So all those in favor of accepting this report with the nuanced little bits that we're going to do along the way, please hold up your hand and vote yes. All right, let's take those down. Do we have, I'll let that get done. Before we make sure we've got everybody's hand down before we go, is anybody concerned and want to talk about this some more? And does anybody want to stand aside? Do we have anybody who wants to block us submitting this report and does not give consent? All of these are perfectly okay places to be, trust me. And if you're not comfortable saying it out loud, you can always send a private message to Joylene. All right, I'm going to give it back to Anna and say thank you so much for your support with this year's legislative report. We will definitely make a few edits in here and we will get it out on time to the legislature. And we appreciate your support and engagement. And I do want to give a really big shout out to the legislative committee. Y'all worked really hard. You had some great feedback. We had some really great, very educational conversations. And I appreciate so much the honesty and willingness of people to share their truth and agree and disagree in that space in a way that allows all of our voices to be heard and understood. Thank you so much.
We're ahead of schedule, Annette. If we want to take a full-on 15-minute break, we could come back at 2, I'm sorry, like not even 2, 1:58. Do you want to come back at 2? Just have a normal time?
2.
Yeah.
Okay, all right. Well, then I will stop talking and fix the slide while Annette officially puts us on break.
Okay. Welcome to break. I'll see everyone at 2 o'clock. Thank you.
1 minute until the meeting resumes. If you are near your computer and can hear, start migrating back, please. I see Sonia and Cindy and Anderson and Robin and April and Emily and Carissa. Thanks for turning on cameras, folks. And Dana and Annette. Hooray! Allison's here. Jolene is here. Dan is here. Thanks, folks. Welcome back. Also, welcome back, Justin, who is not a member of the council, but has been on vacation and is my personal support human. And I'm just really grateful to see your face back in the room, Justin. Welcome home.
Happy to be here. Thanks.
That mustache is getting better and better every time I see you, Justin.
I'm thinking about doing a Salvador Dali thing and just waxing it out to about here, but we'll talk.
I think Dana loves that idea. I could tell.
I just need more material to work with when it comes to Justin. So please do that, Justin. Do that.
We'll do.
Make sure I'm around for that.
Throw a cowboy hat on, you'll start looking like an Earp brother, in Tombstone. So, well, welcome back, folks. It's just after 2 o'clock. We're a couple minutes early, but now is the space reserved for public comments. So if folks are members of the public and you wish to provide comments, now is your opportunity to raise your hand, or if you don't want to do it yourself, you can feel free to chat with Joylene, Annette, or Alicia, and they will go ahead and share that information for you. This is my attempt at therapeutic pause. So I'm going to continue, leave some space. Learn from my good friend and council member, Jackie. I'm doing my best.
Joylene is checking both her phone in case you're texting her, as well as her email in case you want to reach out and have her say something to the system or about the system that isn't comfortable for you to say yourself. And that is also available for that, as well as Alicia. They don't have as many contact mechanisms open to you as Joylene does.
Oh. Not hearing or seeing anybody. So we are a couple minutes early still, so someone may have been waiting to pop in right at 2:05. So we can go ahead and move on and then just monitor if new members come. Can we do that easily if new folks join? Anna, can you see that pretty easily?
Yep, I can see if anyone comes in, and Joylene can too. And so Joylene, if you will just let me know or interrupt the meeting, whatever you think is most appropriate in the moment. If someone has a public comment, we want to hear from you. We want to make sure that your voice is heard in the space. So,
well, pass it over for committee updates to Annette.
All right, thank you, Adam. Now we're at the point where we're going to hear committee updates. We have from now until about 2:30 approximately. So I'll call on each committee chair and you can provide us with a few minutes of information on what you're up to in your subcommittee. Let us know if you have opportunities for people to get involved with your work, please. And with that, I'll go first and talk about what the DEI committee is up to. A couple of things. We're actually trying to work on a plan on how to implement the GARE tool in work that's being done on the council. So, for example, some of the report outs that were done today. In the future, we'd like to apply the GARE tool to that to make sure that that we aren't causing harm by those who are directly impacted by the decisions that we make. So that is currently what we're up to. We'll be meeting again on the next Friday. So if you're able to join us then, you're absolutely welcome. So I hope I encapsulated everything that we're doing, but we're really trying to be very strategic on how to make sure that our adoption of the GARE tool really is implemented to have it the most impact on those families that sometimes are forgotten about. So and other populations. So that is what we are doing. Did I miss anything? Okay. All right, then we'll go to the state agency standing. Grace.
Grace is, I think, on vacation.
Okay.
And so I will just quickly say State Agency Standing Committee has heard two new barriers. I'm looking down at Christy. Was it 2 or 3? I think we heard 2 in the meeting prior to, and then a new one in the last meeting. And so those are in the process of getting assigned to an agency lead, having somebody sort of take responsibility for pushing the ball forward and figuring out who else is going to play supporting cast. The barriers that we pick up at the State Agency Standing Committee are cross-system by nature, so no one single system can solve that issue on their own, or they wouldn't have come to us. So some of those topics are services and supports for children with behaviors that have been identified as sexually challenging, and there's a whole host of that type of behavior, gaps in services and supports for both families and youth who are experiencing those challenges. We heard some great progress on the barrier around hiring timelines for personal support workers and direct support professionals for people who are trying to bring a service provider in home regarding their intellectual or developmental disability. That was a barrier that was actually raised like 3 years ago, and some administrative changes have been made and some process changes are ongoing to decrease that timeline from what was an average of about 3 months to an average of like 6 weeks, which still seems like way too long, but it's improvement, and they have some other improvements in process. So that was exciting. We celebrated success there. And we are also looking at, we're going to hear a report on the barriers that have come in from the CCOs, the community care organizations that are working at the local and regional level to resolve barriers and discuss themes of what are we seeing across the state that maybe the state can take some leadership on without waiting for something to get formally escalated via the process. So that'll be our next upcoming meeting. If you are interested in the nerdery of systems change, that is really the place. So please join us in State Agency Standing Committee moving forward.
Thank you. Andrew with the Data Committee.
Yeah, hi. So we are focused primarily on the system of care assessment that we've talked about in this group before. I can't remember how recently, sometimes the meetings blend together, but that assessment is on target to be finalized by the end of this calendar year, answering the questions of, you know, who's being served within the system and who is not, what's working and what is not, how much money is going into the system and where is it coming from, things like that. There's a number of different components to that assessment, some being done by the University of Connecticut, some being done by OHSU, and some being done by this group, the System of Care staff. So that will have a qualitative element. It won't be all quantitative. We're working, and the data committee is not so much driving that part. They're more kind of a sounding board and advisory to that process. But but we're working on putting together some focus groups to get some direct feedback from youth and families who have been served or are being served. So that's kind of what we're talking about most in that committee.
Thank you. Emily, you want to report on grants?
I was hoping Christy might, because I missed last week, because I was not on an amazing vacation, Annette, but was taking a mental health week off.
Yeah, I'm happy to jump in here, Emily. So grants committee has been focused primarily on wrapping up the 21 to 23 funding cycle, mostly looking at final reports from our regional system of care partners and also looking at final reports from the work that happened in the with the tribal funding. And just to say, like, really incredibly beautiful things happened with that funding, particularly among our tribal partners. So if you are curious about what that work looked like and want to see some of the things that they have shared with us, either to bring them to a future council meeting, we're just happy to share those reports. At the last meeting, we also looked at the first report from the 23 to 25 funding that went out to our regional partners. Most of those grants are just getting underway, so there wasn't a ton of reporting. I'm anticipating we'll see a lot more activity in the reports to come. But those dollars are out the door and getting spent, which is great to see. We held a learning collaborative. So one requirement of that funding of our regional partners is to participate in a quarterly grantee specific learning collaborative. We held a collaborative, I think it was back in July or August, on agile funding and talking a little bit more about what folks are doing with those funds, how the dollars are being spent to serve families and young people, talking about how our partners are thinking about leveraging other funds like the new health-related social needs dollars coming on through Medicaid, share funding, health-related services funding, talking a little bit about the administrative burden associated with those funds. So anyways, it was a great learning opportunity. And I think moving forward, the grants committee is ready to start talking about the next funding cycle. So the 25 to 27 to $25 to $27. If there are changes that the council would like to make in terms of how those dollars get spent. So if that sounds like a topic you have opinions or ideas on, we'd love to hear it. Emily, anything else?
Nothing else. I would just say, I think one thing that'll be top of our list as we go into the next cycle is repeating what we did last year, which was really having thanks to Joylene and others, really robust youth and family engagement. So we'll keep that and continue on forward.
Thank you. So Robin, then Anna, and then back to Christy.
All right. Well, I think you all just got a big taste of what the legislative committee does, although we only do that once a year. Usually what we do is we look at legislation that's coming forward, different concepts that different partner organizations have, gives us an opportunity to dig in and create suggestions, and look at our own legislative agenda. We're getting ready to get into the fun time of year when we're going to see a lot more concepts start to come through our committee. We tend to meet in the off season, we meet once a month. When we're back into the on season, which we're coming into, we meet twice a month. We welcome anyone to the table who's got an interest in the legislature, who's got an interest in making these types of changes, or who just wants to learn and be a fly on the wall. We have very robust conversations and a lot of conversations about difficult topics that people are very passionate about. But we're about talking about the topics and about making sure that this is a safe environment and a safe space to really think through how we move our system forward. What are the barriers we have in our system that are created by our own statutes? And how do we help our state get out of its own way? Come and join us. We would love to have you.
And that's me up next on the Workforce Committee. The House Bill 4151 Workforce Committee is just kicking off. Our first report to the legislature is also due on September 15th. So big day in the administrative life of the System of Care Advisory Council. That report is going to be filed, I believe it's due tomorrow by 5 from the contractors, who are the Center for Excellence, which is a part of the Alliance for Kids. So Vera Stolil is the contractor who's leading that work. So far, we've called together a steering committee of System of Care Advisory Council members and some other partners who have a lot of opinions and expertise in that world, like some of the folks from the Ballmer Institute. What we are tasked with doing is a list of recommendations for the youth behavioral health workforce, with a focus on people who have education below the master's level. So there's been a lot of work in workforce at the master's level and above about how do we train folks, how do we certify folks, how do we get folks in. But when we're looking at peers, when we're looking at bachelor's level clinicians, folks who are often doing a lot of the really hard work on the ground, we don't have as much infrastructure created for that population, and we are not paying those people well. Oh yes, and Yellowhawk has a representative on that committee as well. Thanks, Cindy. So the first report will just really focus on the structure, and then the future reports will focus on what the actual recommendations are and what we want to see change, both at the legislative level and potentially at the agency level. If there's practice or policy changes that do not require a law change that could be effective, we will focus on those lower hanging fruits. So more to come. If you are interested in workforce stuff, let me know. We will get you engaged one way or another. And I think, Christy, it's your turn to talk about respite. The respite.
Yeah, I sure can. And Adam, as the CCO and SOCAC rep to the respite work group, if you have anything you want to add in onto this, please jump in. So the respite work group is a pretty new group. This was officially stood up after you all approved that youth respite report this spring. So the purpose of this group is to advance the recommendations that were found in that report. We don't want that document just to be something that kind of sits out there and nothing happens with it. And there's a lot of great ideas and strategies that we want to make sure happen. So we have a new work group. This includes representatives from our local system of care partners, our state agencies. We have youth and family participating. We have providers participating. Anna Peterson is official kind of liaison with that work group and SOCAC. So just getting started, we got a charter together and then looked at the subset of recommendations in that report that had been prioritized by youth and family and some of the work groups that we had convened earlier this spring. And really kind of asked the work group what they all wanted to work on first. And to get started, we have decided to focus first on kind of building out some communication and outreach materials. What we heard in that respite work was a lot of confusion and misunderstanding about what respite is, who it's for, where to find it, where to access it. So working together to develop a series of fact sheets, kind of audience specific fact sheets that kind of share out our shared understanding and definition about respite, with partnership out of the Lynn Lincoln Benton System of Care, working on some resources that will help to kind of share out the available respite services that exist. And then also working with 211, I had a great conversation just last week with the person who directs the childcare programming at 211. 211 has a lot of respite information in their system and provide a lot of referrals and hear a lot of needs for respite. So I'm excited to kind of talk with them about how we can share data and partner to provide more accurate information about what's available. So, Adam?
Yeah, I think a lot of it's been level setting amongst different agencies about respite and definitions of respite, what counts, what doesn't, and where, kind of hearing all perspectives to begin with. So I'm excited to now start diving into the work. It feels like we've gotten kind of a shared understanding about the scope and what we're looking at. And now I think we're going to get to some real meat of what we're looking at.
Mm-hmm.
Thank you. Yeah, we'll go to, for family in development, we'll go to Joylene, and then youth sub-sud collaborative with Joylene or Kayla.
Thanks, Annette. Yeah, so I'm actually going to start with what is going on in the planning of our family subcommittee. And so Annette, myself, and Alicia have been coming together semi-regularly at this point to really get down like the roots of what we want this family subcommittee, council, whatever we end up calling it to be, how we want it to function, the types of people we want to have in the room, and the kinds of supports that we want to have available to those folks. So for all of you who know, who are in the convening of council group spaces, basically what we're building is a charter. And so we're looking through different examples of charters. We want it to be something that's approachable to family members, regardless of where they're coming from. And so we are just having those initial conversations. I believe we're also at a point where we're getting ready to open it up to other family members in this meeting, or just engaged with System of Care Advisory Council if they are interested. I may be speaking directly to you. If you are a family representative in this space and you are interested in joining in the planning stages of this family council, please do reach out, put your name in the chat, message me directly or Alicia and Annette. I am going to open it up for Annette and Alicia to kind of fill in some of the gaps if I left any. Is there anything else you want to share about this?
No, I think you pretty much covered it. I think we're what's supposed to meet sometime this week again. There are some things, there have been some conversations about ensuring that this process is really family member led and built. There are some historical documents that I have been able to pull from that have been built by family members, and we're hoping to kind of integrate some of that, so basically we don't have to start from scratch all over again. Make our lives a little bit easier. Yeah, other than that, I think I'm hoping that we can get this going sooner rather than later, since it's been a long time in the making.
Absolutely. Thank you, Alicia. Yeah, I echo all of that. And I see a thumbs up from Annette. Y'all, it's a lot to carry to be one of two family reps asked to represent the entire state of Oregon, all the different communities and cultures, right? That's a lot for Alicia and Annette. So we're really hoping that this space can be an area where they can get to know what's really going on in these different communities and meet folks, connect with them, and then bring that knowledge back to full council in the ways that they get to vote on behalf of the rest of the state. So we are very, very excited and hoping to get this off the ground sooner rather than later. We also have a new family engagement contractor. They go by Common Thread Consulting. Incredible team of 3 people that are really going to help us in forming this council, as well as sharing with the rest of SOCAC the different best practices for how to best engage with family members, because this is something we need support in. So that's that on family council updates. I next want to share about youth council. Jesus is not able to be here, our youth chair, but she's given me permission to share this. So youth council members have been busy. The one new development is that we are officially implementing the GARE tool in youth council's decisions. We've been a little bit behind because the rest of the council's already started kind of picking this up, but Annette was gracious enough to come to youth council and present and show folks how to do it. So now that is something they voted to officially integrate into their processes. The GARE tool, again, is the government. I don't actually remember the acronym. The racial
Accountability for racial
Thank
equity.
you. Government Accountability for Racial Equity Toolkit. That set of questions Annette presented at the beginning of this meeting. So that's very exciting. Youth Council has also been diving into all things policy. And so by policy, I mean internally, they are trying to figure out what policies and procedures they want when they bring in new youth. So application, recruitment, orientation materials, as well as like processes for how long youth get to stay on youth council, what happens if folks leave or go to college in another state. All of those are questions that the youth council is diving into and building their policies for. Outside of actual youth council, one specific member of our youth council was incredible in taking their lived experience and turning it into 3 different policy concepts. He was on this call earlier, but he's not there. Yes, thank you, Emily. We are cheering for Caleb Gamby. Youth Council has been in full support of Caleb's legislative concepts, decided that they want to put their power behind these ideas and make sure that we can get these ideas into the legislature one way or another. So in this moment, we are at a point of searching everywhere that we can for sponsors for these concepts. It means a lot to these youth. None of them have ever pushed any kind of policy into legislature before. And so this is a big deal if you are a person who is, if you are connected with lobbyists or legislators that are interested in youth addiction, recovery, treatment, supports, or unaccompanied houseless youth or foster youth and that are trying to get education, like those are kind of the themes that these ideas surround. So please do reach out to me, put your information in the chat, or I will reach out to you, but we are looking heavily for some supportive sponsors. And Emily has actually been very helpful through DRO. I'll go ahead, Emily.
Yeah, I was gonna say it's been fun, and I have a meeting with my executive director at 4 today to be like, hey, what official role can we play here? But I just wanted to flag too that Oregon Foster Youth Connections, Julian, I don't know if you saw that email earlier, but it looks like they have a similar concept with a sponsor and some tentative budget talks. I know nothing about it, but I don't know how much the this task force connects with the Oregon Foster Youth Connections or the other youth-led organizations, but it's just for me, it's a reminder that we can all be so siloed in our work. And it's hard to like pause and sometimes reach out, but I hope what I heard was true and that Caleb's got an in.
We are looking for an in, so we'll happily take any kinds of connections, at least to see what is or can be possible. All right. Finally, I'm also going to talk about the last line here on the screen, the Youth SUD Collaborative. SUD stands for Substance Use Disorders. First big update is that last week in the meeting, this group came together and actually finally decided on a new name for this collaborative. And so the new name is the Oregon Youth Addiction Alliance. Folks thought that would be a lot more approachable. And it comes with the tagline, just like the Kool-Aid Man, oh yeah, Oregon Youth Addiction Alliance. So that is a collaborative space between the Alcohol and Drug Policy Commission's commissioners, as well as SOCAC's Youth Council, youth leaders. They have been coming together regularly to try to tackle youth addiction in the state of Oregon, and make some legislative requests. So they finally have a name, and we are also opening a big recruitment for new youth, young folks between ages 14 and 25. If they have lived experience with youth substance use, I am going to put a link in the chat to a survey that we're asking for all of our partners to distribute, if possible, within the next month. We want to get folks with that lived experience across the state, different identities and cultures, so that we can, at the end of the month, look through those names, bring some people in, of course, pay them and support them through the onboarding and throughout this whole process of getting involved in our work. But we are opening it up to other youth. That meeting is in partnership between youth and adults, although right now the youth are the facilitators. They are the people who planned this space from the beginning. So this is truly a youth-led space, and the commissioners are enjoying it. It's a good time. I see a question here, Alicia. Youth under the age of 18 would also be compensated? So traditionally, the answer to that would be no with our policies, although we do have a new youth engagement contractor. And one of their core responsibilities is to figure out how to pay folks for their time and expertise outside of kind of the bureaucratic guidelines that we traditionally have to work within. So I'm not going to give a hard yes, but I will say that I will verify with our contractor to make sure that they can pay folks under 18, although I do think that they can. And yes, Sandra, I will actually write out some content to send. We'll make sure that that's in our next SOCAC Digest newsletter. But if there is follow-up information, I will send a little write-up with a link to that youth application for the Oregon Youth Addiction Alliance group. And you all can reach out, send it to your people. Let me know if you have any questions, and I'm always, of course, here to help answer those. Oh, one more final thing, I promise. This is actually what got skipped at the beginning of the meeting today. Those same youth leaders, in collaboration with Liz Thorne from Matchstick Consulting, created a youth adult partnership training because this work is so heavily, like, it needs to be in true partnership between youth and adults. They have created not only a training specifically for this work group, but right now, as we speak, those young folks are recording an asynchronous training that they want to share I hope you'll participate. Thank you all.
Well, thank you. I think that is the last committee update.
Yeah, and I screwed up the presenter's agenda. I apologize. I didn't have a single free minute. I missed the strategic planning part on the presenter's agenda.
Okay.
So it's in the slides.
Cool. That's exciting. We're full of surprises this afternoon. And we're ahead of time. So, like, I think this is great. I can't wait to talk about the system of care strategic plan visioning. And by me talking about it, I mean introducing it and then turning it back over to, I think, Anna and Christy. Yes?
Christy has taken this one. You know, strategic planning is not my skill set. So, Christy Hudson, are you ready?
All right, let's do it. Okay, the time has come for all the dreamers in the room. This is going to be, I hope, an exciting 45 minutes where we can all get off our hamster wheel that we run on every day and just stop and take a look around and think about where we're going, think about where we want to be, and have some rich conversations about it. So, we're going to talk a little bit about the vision that you would all like to create with our next strategic plan. So the current vision, as written in the strategic plan that is guiding our work through the end of next year, says that we are working towards a future where young people from all backgrounds are healthy, safe, learning and thriving at home and in their communities. We brought this statement to last week's core group, who's kind of doing all of the preliminary thinking about this vision. And we said, what do you think? Do you like when you all came up with this current vision? This was, and if folks are here and kind of want to bring some of that history forward, that would be great. But the core group thought it would be best to spend a little bit of time in today's meeting kind of generating some ideas about how to improve this. So just to make sure we're all on the same page, the purpose of a vision statement. This is a written declaration that clarifies our purpose and describes our long-term outcomes. Vision statements are aspirational. They are future-based. They are meant to inspire, and they are meant to give direction. So the question that I want you all to think about today is what is your vision for the system of care? When we think about, at that point, sometime in the future, maybe that's 5 years, 20 years, maybe that's 50 years, and we have created the system of care that we all are trying to get to, right? That's why we're all here together. We're trying to improve things. We're trying to get to that vision. What would it look like? If you looked around, what would you see? How would families be different? How would young people be different? How would these services and systems be different? So we're going to break you all into breakout groups for, let's say, like 20 minutes. Anna, can you advance to the next slide for me? And instead of just kind of putting you all in a room and having you all kind of, randomly talk, we're going to be a little bit more structured in this process today. So we're going to put just council members, sorry, anybody else. We're asking governor-appointed council members only to participate in these breakout rooms. So if you are not a governor-appointed member, please just hang back and wait for the report out. We'll put you in rooms of 4 to 5 people. When you get into that room, there are a couple things you need to do. One is to identify a timekeeper. Okay, we're going to keep track of how long each person gets to talk. So you're going to need one person who's got a phone and can kind of mind the time. Each person's going to get a minute, and then it's going to move to the next person. So find a timekeeper, and then find one person who can be a note taker. Because we're unable to record the conversations in breakout rooms, we do want to know what happens in those rooms. We'll have a little bit of time for report out as well, but we're going to take all of this conversation, both what you report out when we come back together, as well as any kind of notes or highlights that you email to me. We're going to kind of work those, massage those, generate maybe some new and improved vision statements that we'll bring back to the core group and bring back to you all. So that's a little bit about how we're going to try and capture all of this rich conversation and dialogue. We've got some new agreements for this particular exercise. And this is all coming from Liberating Structures, which is this cool website that was just kind of introduced to me. It's got a lot of really interesting exercises for group thinking and an expansive dialogue. So that's a little bit about where this is coming from. I didn't make this up. So the agreements for this exercise are going to be speak what has personal, heart, and meaning, right? We're really looking for you to speak from your heart, from your experiences, from what brings you to this council and the work and energy you put into this space. Go for honest and depth without going on and on and on, right? You're each going to get a minute and the timekeeper will help with that. We're inviting and honoring diverse opinions. There's going to be disagreements and all that, and that's fine. We're not going to dialogue and talk about those things. We're really just trying to harvest kind of all of those ideas and visions you have. Seek to understand rather than persuade, respect one another, and suspend judgment as best you can. So we're going to do 3 rounds of sharing. When you get into that room, you'll pick your timekeeper, you'll pick your note taker, and then there's going to be 3 rounds of sharing. The first round is, what is your vision for the system of care? Just kind of like stream of consciousness. You're going to share for 1 minute. Timekeeper will tell you when your time is up, and then you'll go to the next person. So each person will get a minute. And then the second round begins. The second round is, what additional thoughts and feelings do you have after having listened to everyone in round 1? Again, each person only gets a minute. You'll continue sharing. And then the third and final round is just general dialogue. That's where you can be a little bit more kind of organic and conversational. So open sharing of takeaways and themes. And hopefully that will help kind of synthesize what you want to report back to the full group. Any questions before we send you off?
So each round, everyone gets 1 minute?
Yeah.
Got it.
Yep. So let's say you have, Anne, did you put rooms of 3 or 4, or how big did you create the rooms? Or did you just
I think
automatically?
one room has 6, but it's a staff.
Okay. And staff will join the room. Is that what you're thinking here?
Yeah.
Okay.
Yeah, I can stay out or I can go in. I didn't assign myself because I couldn't for some reason. It wasn't an option.
Okay.
So if you got a blue join button, please go ahead and join your room. If you did not get a blue join button, you are probably not a governor or chief justice appointed member of the council. If you know you are a governor or chief justice appointed member of the
Before I think, oops, she was still talking and I pushed the button.
I think we all did.
Yeah, I was like, oh, sorry. Right in mid-sentence, I left the chat.
Okay, I think, what do we have? 5? Oh, 1, 2, 3, 4, 5.
5 of us, a minute each, 5 minutes.
Got 5 minutes. I can be the time taker if you all want me to be.
That'd be awesome.
Or the note taker, whatever. Oh, I just realized apparently my stopwatch has been running for the last 50 hours.
Oh boy.
50 hours and 53 minutes. So we're just each speaking to what our vision for systems of care is. Is that correct? And then for a minute each?
Correct.
Does someone want to be the note taker? Or you want me to be the time taker and the note taker?
Okay, that's a lot to ask. Oh, here's Andrew. He's late to the game. We could make him the note taker.
Definitely good to time that person.
You assign duties to the people that aren't here. Is that how it goes? I don't know the exercise even. I had to drop off for a work emergency and I came back and everybody was in groups. So
we're just going to each speak for 1 minute on our speak from our heart on what our vision is for systems of care. Pretty open.
So I'll start us off. if you guys are okay with that. I don't know how much time we have in each of these groups until we get kicked out. I'm not sure what that looks like.
Yeah, I don't know either. So we probably should get going. Usually it's not enough time, but
Okay.
who's taking notes?
We all jump in at once.
I'll take notes since I was late. That's okay, but hold on, I gotta pull up a little note taker.
Thanks, Andrew.
I'm ready to go.
Okay, person number one.
I think when I think of system of care, to me, I feel like a vision statement could be something like working together to ensure Oregon's young people and families from all backgrounds are thriving in their communities. To me, systems of care is about everybody coming together to support. It's not about just one group of people. It's all of us working together as a team to ensure the success of our families and youth. So to me, I feel like we should have something in there about whether we word it working together or however that looks. But I do think that it's a collaboration or a coming together in some way.
You got 25 seconds left.
Oh, I'm done. Somebody take over. You can have that.
Okay.
I should know, but it says Yellow Hawk, but I don't know your first name. What's your
Oh, I'm
name?
sorry, Cindy.
Cindy,
I
thanks,
changed
Cindy.
that.
I wanted to make sure I had the right person's name.
Sorry about that.
Robin, you want to go next? I'm just looking. on the-
Sure.
Okay.
So when I think of system of care, I think of all of the different entities that on an ideal planet should network together in support of children, youth, and families. And that kind of almost a village and a safety net, in essence, that should function to care for children, youth, and families when life happens, and keeps them safe, keeps them whole, keeps them moving forward. I don't think we have that at this stage in the game, but that's what I think system of care should be.
Great. Under 40 seconds. Sonia, you want to go?
Sure. Yeah, I think what was coming up for me and just reading the existing one was the statement was really like a universal type statement. And while universalism is important, it also should be very clear about specific target populations, because like when we say all youth from all backgrounds, the problem with that is we live and operate in a dominant culture. And so that's not who's centered. And so I think, like for me, thinking about, all youth from all backgrounds thriving with, attention and specificity around those who have been harmed throughout history and marginalized populations and groups that are being left behind, that don't have a chance to thrive until we change systemic structures. So like for me, the vision, we have to get really clear on that in every way and very intentional on that. Otherwise, we'll just continue to repeat the same things over and over. So that's what was coming up in my heart and mind in looking at the previous one or current one.
Great. Who's next? Corina?
Sorry about that. I wasn't sure if this space was really for me, as I'm SOCAC admin and I'm learning a lot and new to the team. So I really appreciate all the pieces that you guys bring up, but I don't know that I have a ton to add, just more to take in.
Okay, welcome. I'll go. So I mean, it's hard for me to like actually speak about like the actual statement, to think about like what my thoughts are in regards to like the actual statement. But I know my hopes is that like all of us partners, families, and youth could build relationship with each other so that we have investment in working together and supporting each other and collaborating and and trying to make up for each area that is lacking, I guess. Or the way I've seen work like this be really successful is when, like, I know Sonia, I care about Sonia. I know that her agency has strengths here that could help me. I know that my agency has strengths here that could help her, and that we actually care enough to like call each other up and say, hey, let's work together and make this work. And that's where I see, actual outcomes happening, is when we're caring about each other and the work that we're doing. And I went over 6 seconds, but I'm the timekeeper, so ha. Andrew, I think you're the last person.
I mean, oh yeah, I don't really have a whole lot to add to what you all said, except to say that, some of this is like technical, like the funding side of things, and all of that should be invisible to youth and families. It's right now, the youth and families that are being served are being expected to learn an unlearnable system and figure out how to navigate, whether who pays for what and under what circumstances. And I feel like a system of care kind of does all that stuff on the back end, and it's invisible to the youth and families who receive services. But everything else you all said, I would have said too.
Great. 4 seconds to spare, Andrew. Oh, is that all we were supposed to do for this round one? This was round one, right?
Well, I have to unmute. Great question. I thought there were 3 questions we were supposed to address, but were we doing it all in round one?
No, I don't think so, because the next one was like additional thoughts and feelings based off what you hear back, what you heard in round one. I felt like that was after the share out and then the comeback.
Yep.
Okay, I'm still a big fan of let's take everybody's thoughts, put them into an AI generator and see what vision statement cranks out.
AI is everywhere. Could be very helpful.
Yeah, so round 2 is, now that you've heard everybody, what other things come up for you? So maybe we could just go in reverse order. You want to start, Andrew?
I'm sorry, what's round 2? I was literally looking up an AI generator. I was going to plug what I typed into it and see what happened, but I probably shouldn't get distracted like that. Thanks, Robin.
See,
You're welcome.
So round 2 is now that you've heard from everybody. Do you have any other additional thoughts or what comes up for you?
I don't. I'm reminded hearing from you and Cindy that we have a special obligation to pay attention to historically marginalized communities. I think that is often held in kind of hearts and minds while we're doing this work, but I think we need to continuously kind of stay on that page.
And then Sandra, you'd be next.
Yes, I think I'll agree that it is for many people an intentional, it is intentional and part of the work we do. And I think if we aren't specific and call it out, that things often don't happen or move. So I definitely appreciated what Sonia had to say about the need to be very specific and intentional about it, our marginalized communities. I think we could do better, honestly. Who's next?
I think Robin.
You know, what I think about, and I appreciate the focus on, oh, am I muted?
No, you're good.
Okay. I appreciate the focus on historically marginalized communities. I think when I look at Oregon, having lived, you know, I spent 15 years of my life in Bend working for St. Charles and seeing life from that very populated, but on the cusp of everything that is rural and frontier. We don't do a great job in this system of acknowledging the incredible diversity created just by our land and the way our land is laid out and the way the people who inhabit different parts of our land really have very different cultures than the world that happens in the great state of Portland. And we create, I'm struck so much by, and Andrew will laugh because he's been on this council with me for a while, by this issue that comes up where people go, oh, well, we're the same size as Connecticut. And the assumption that programs that work in Connecticut are going to work in Oregon when Connecticut, I think, fits in the city of Portland. It's just not the same thing. And life moves at a different way, to a different rhythm, to a different timbre. And I don't think we acknowledge and appreciate the incredible diversity just created by the land that is Oregon.
Sonia.
Yeah, I was gonna see if Karina wanted to add anything yet or no. Okay. Yeah, I think one thing that I started having thoughts of was hearing a lot about the talks about systems and partners and collaboration, and it just, you know, kind of made me think of just recent experiences, and also having been in the juvenile justice system for 25 years. And, you know, we talk a lot about silos and like our own worlds, and that's like, we were talking about that 25 years ago and probably 40 years ago and probably et cetera, et cetera. And I think there just has to be some very intentional work around, you know, decolonizing and dismantling the way that our systems continue to operate. And I know that that's supposed to be some of what we do in SOCAC, and yet we're so embedded, and the system is so embedded in us and how we operate, that we haven't really dismantled much. So I think that's what folks were sharing made me think about, of just, you know, how do we get back to really kind of, yeah, decolonizing, dismantling, kind of burning it down mentality, and building something that's completely different, that wasn't actually designed to separate and be competitive.
Best for last, Cindy.
Right. What I think about is, and I think everybody has spot on comments. I think our hearts are all, you know, in the same place. I think we're striving for the same goals. What I think about when they ask us to look at a vision statement is, I think that your mission statement could definitely more clearly define your goals and your, you know, your values, your purpose. I think the vision statement has to be much smaller. I don't think we can go into great detail in a vision statement. I think it's supposed to be fairly, I don't want to say small, but I just think there's a difference between a mission statement and a vision statement. So I would like a little more clarification on like what we want that to look like, because I could go into really big detail as far as a mission statement, right? Our core values and, you know, all that stuff. But I don't think that's what they're wanting. I think the vision statement is supposed to look different. So anyways, that's just what I was thinking about the whole time, because we're all spot on with what we would like to, this to look like. Oh, they gave us 5 minutes.
Perfect. We got 5 minutes.
Yeah.
The last question, I think, was just open share of takeaways and themes.
I already went. You guys can go.
Did you have any thoughts, Robin? Any additional open share takeaway themes?
I think one of the growing things that's happened is it's been so wonderful to see more diversity come onto this council. When we first started, we were very heavily laden with agency folk in agency land. And that drove a lot of our agenda. It drove a lot of the way we thought. It drove a lot of, I still remember the infamous ability to, at one point, we were supposed to create this paper about braided versus blended funding. And what came out of it was basically a paper that said, well, you can braid funding, but you can never blend it. And just that narrowness of opinion, it's really refreshing. I think the broader that we've become and the more independent we've become, the better we've gotten at thinking differently about our system.
Well, for my part, I mean, I kind of want to stop talking about it and do it. And I don't exactly know right this very minute what that would be. And maybe that's part of the problem. But I feel like as an Oregon value is sort of a lot of process. And maybe that is to the good to ensure we have full participation and full kind of thought through ideas and everything else. But I'm kind of coming to more of these forums these days, thinking of this guy who was a donor to one of our programs once. He owned a bunch of car dealers, and we were in a meeting and we were talking about all this process stuff, and he just looked at me and said, "When are we going to sell a car?" And that sort of comes to mind every once in a while for me, is sort of like, are we going to just document our process and our thoughts forever? I mean, for example, like, and maybe I shouldn't ramble on about this, but for example, years and years ago, the little group that came together that ultimately formed SOCAC said, we probably need, a less fracturing in the system, maybe an entity that handles kids with high needs from wherever they are, instead of sprinkling them out over 15 CCOs and 16 child welfare districts, and nobody can focus on specialized needs. And we're still sort of hovering around these ideas, and maybe one day we'll do something about it. But anyway, that's my cynical view. But I'm not always cynical, just right this minute.
We have 2 minutes left for any last takeaways or themes. I do think it's that fine balance of processing and getting input and being inclusive and then moving to action and feeling like we're not just talking about things all the time. Andrew, do you feel like you have all the notes taken that you can report out?
I have the notes that I will send to you to report it. No, I'll do it. I'll do it. But if I get anything wrong, I am not at all sensitive about being corrected.
Thanks, y'all.
Yep, thank you.
don't want to be showing you my email. All right, some folks will be whooshed out of whatever they're saying momentarily and back into the main room. It's like rooms 3 and 4 are really having good conversations. Thanks, Cindy, for being here. Appreciate you. Bye, Justin. Good to see you.
Bye.
All right. Thank you, everyone, for coming back in. Is Christy with us again?
I am here. Yeah. Okay, how many groups were there? How many breakout rooms were there, Anna?
There were 5, I believe. No, 4. There were 4.
4 rooms. Okay. And how much longer do we have on this particular topic?
We have, sorry, let me get the correct agenda up. Until we have another like 15 minutes.
Okay.
On this.
Okay, that's great. Can you go back to the prior slide for me? Okay, so let's take a few minutes to hear from each breakout room. I'm super curious to hear what the other rooms talked about because the room I was in went in a very different direction than I was anticipating. So I'm really curious to see what happened in other rooms too. All right, we'll just start with room 1.
Well, there was no room 1. Let's go to Adam Rodakowski, Anderson, Du Bois, April Flint Gerner, Jill Archer. What happened in your room?
Yeah. We tried to follow the directions. I think we did. It wasn't like a succinct vision that we came up with, but we went sort of one after the other. And it was shared that we should have a state that doesn't make kids fail before they get access to the things they need. The system defeats them before they get access to the things they need before they start. And so it's important for them to feel like a part of the community and not so isolated. And that to maintain and really speak to that focus of having the system created by families and youth that are directly impacted in order to make real the vision that we hope to have. As well, that there's a hope that the system of care is a place to prevent the unnecessary overreach that has historically oppressed families. If families and communities have what they need, then that would make obsolete other systems that have been created. It should be a place where people's born intersections of identity should not be a clear predictor of outcomes or health, that there should be more efficiency with policy and funding strategies as a function. It was said that it is critical to focus on universal prevention and a state that focuses on social determinants of basic needs of food, shelter, and downstream impacts. And streamlining the work should be so blended that there should not be a clear distinction between departments from the viewpoints of families. And then lastly, that the vision is for Oregon to become the best practice for what other states should reach for in taking care of its communities. So not a succinct vision, but kind of putting a lot of those different ideas together. And I can email that out if needed.
Yes, please. That would be great. Thank you, Anderson.
Room 3 was Alicia, Christy, Emily, and Jackie.
Yes, and I was listening in on that room and was taking some notes, so was voluntold to synthesize what was shared. This was different to me. This felt a little bit more of like an internally focused conversation about the role of SOCAC. There was lots of conversation about desires to be more family-centered, family-driven, leveraging kind of like holistically the assets that families bring every day into our systems. appreciation for words like inclusive and responsiveness to changing and diverse needs, creating space for people, young people and families to kind of amplify their voices and their experiences. Talked about desires for an apolitical system of care, a system of care that is advancing systems change and really, again, kind of amplifying and rooting power of particularly younger youth as well. There's interest in really hearing more from the experiences of those like under 18 years of age. Talked a lot about, again, just like responding to the gaps that families are currently experiencing. Just, making sure that people have the readily available services and supports they need, inclusive of things like social determinants and other systems of oppression. Just reading my notes here. So a system that meets the needs of families before, oh, I'm sorry. That's what I was just taking notes on, Anderson's. Okay. I think that's all I got.
Okay, awesome. Thank you. Room 4 was Adam Peterson, Annette, Carissa, Cody, and Dana.
We had a great discussion about, and actually stuck very closely to the directions. But that's the former wraparound care coordinator in me, I suppose. Really what we came out with is that there are pieces about data equity and health equity that need to be included in anything that we add, and that if they're not explicitly called out, then they're not actually real, and we need to make sure that they are a part of that. Annette said a great thing that we really tried to work with, and that we can't lose any more kids to the streets, to the grave, or to school pushouts. And too many kids have fallen through the cracks. And we then use that as a framework for talking about how do we turn that into a strengths-based future focus goal or vision. And as close as we came to was kids are supported by their families and families are supported by systems. And we know we have a lot more work to do, but that's where we ended up as a start of a vision.
Great.
And thank you very much. And room 5 was Andrew, Corinna, Robin, Sandra, and Sonia.
So we sort of follow directions, did our best. I'll kind of report out the words that I wrote down here, but it's a little less formed than maybe you wanted. The conversation really centered around how system partners working together to ensure that Oregon's youth and families from all backgrounds get what they need to thrive. There was conversation about that being done through the building of relationships so that there's mutual investment in making improvements, and particular attention on youth and families from communities who have been historically harmed by the system, to lift that up in a good way. There was also some discussion about, let's see, the possible need to dismantle what exists. And I know that might be a little hard to hear, but dismantle what exists in order to, kind of rebuild and make something that's designed around the needs that we have today. And there was also discussion around, the administrative kind of messiness that might exist because of federal stuff or state and local stuff or whatever. All that should just be invisible to youth and families. That should just be handled kind of on the back end. Families shouldn't have to be experts in how the sort of spider web is strung together in order to get the help that they need. So I think I covered, I think I covered most of what was said. Yeah.
Awesome. Thanks, Andrew. So we are recording this. Will refer back to the recording as well as the notes that Christy's taking. If any of you who were recorders, note takers, also want to email if you did type anything, that would be great and helpful. We will be taking this and trying to find some threads. I noticed some themes coming out of rooms, right? So try to put something together that addresses the themes and the priorities that were named in this conversation. Bring it back to the strategic planning core team conversation, and then from there it will come back to a full council strategic planning effort that you will be a part of if you are in the room. And the strategic planning process is starting to take up more momentum. So Christy, I don't know if there's anything more you want to say about that, but I don't think there's like a nice bow to tie onto this sort of big vision conversation right now. We're going to continue to work on it and collaborate. So we have a vision that we're all excited about that leads us into the strategic planning work. Is there anything else, Christy, that you would add on that?
I don't think so. I did have, do we have time?
We have another 5 minutes.
Okay,
Yep.
the one, so what I heard in these report outs is there feels like to be a tension between a vision statement that is kind of focused on the outcome of better lives and well-being for young people and families, which I think is what is articulated in our current vision. But I also heard a lot of you talking about a vision for like the system itself. And there feels like to be like a tension in that. And I don't know if people have ideas about how to bring those things together, or if people have preferences for what type of vision statement you might want to have. Anderson.
That's something that I guess partially came up in ours, in the sense of like there's the optimistic like the outcomes, but then there's the speaking towards like how we should get there, which then generally will directly critique the system itself, if that makes sense. And so one of the things that like we're like, well, let's make sure that we point out towards like how youth and families should be involved in the creation of that process. I think and I guess I say that to say that like in order to be clear about how we hope that vision to be accomplished, I think having something in there about the system itself might be really helpful, so that it might ground it a little bit in terms of not just what do we value, but how do we value that? How do we go about like moving towards that? That might be helpful.
Thanks, Anderson. I think I'm also hearing like that talking about the required systems change within like the services like draws accountability to what we're all doing here, right? And releases some of the blame that we put on youth and families for not being able to access what we put out. Emily.
And Chrissy, we talked about this a lot in our group too, but I think Anderson, you said it exactly right. It's the how. Because right now in our current vision statement, as strong as it is it's a future based on whose perspective? Right? Is it a provider perspective? Is it an advocate perspective? I don't see as much of that as like the nexus of power being within a youth or a family member. It seems very outside in. And so I don't know how we get to the how, but that really resonates with me too.
So I'm wondering, sorry, go for it. So, yeah.
Well, I was just going to offer one of the things we talked a little bit about in our space was like for me, the universalism of the current vision statement really leave some people behind, right? And there's a like a framework called targeted universalism, where it's important that we have universal statements like this. But if we aren't clear about the communities that we need to be very specific about targeting, then we're in dominant culture society. So we will just always revert back to that because that's what's baked inside of us. So, and then hearing what Emily was saying, when we use targeted universalism in designing our vision, mission, whatever, it starts to clear a path for the how. Because we can't ever get to this universal mission unless we have some very specific targeted, populations, goals. I mean, yeah. So just something to throw out there that might help the group continue to work on that.
Sonia, that makes me think about the sort of spotlight in the legislative report, the spotlight on Black youth suicide, right? That the way that the numbers are presented, it's like youth suicide in Oregon is decreasing. And so you could just sort of take that and say like, cool, job done, we're going home. But once you then look at specific demographic populations and you see that white youth suicide is going down and it's washing out the fact that either that Black youth suicide is going up and Native youth suicide hasn't changed, then we need to be targeted in terms of, do we have a vision where children are not dying of suicide at all? Okay, are we actually counting it in the right way? Are we putting strategies in place that work for everybody, or are we not? Are we sort of letting the dominant numbers wash out all the other context?
Yeah, and not just in outcomes, but in strategies as well, right? The thing that's working for white youth doesn't work for non-white youth, and we need to be clear about that, which again, that's a lot of the how, that's other work, but if the vision statement just acknowledges, well, the vision should be based in like targeted universalism is what it's called, but yes.
Alicia.
I guess I'd go back to, or I would highlight what Emily had said earlier, is that like whose perspective, right? Even I understand the universalism here in this statement. And I also understand the idea behind targeted universalism, but then at the same time, I'm like, okay, so whose perspective, right? And then using the same example, that Anna, that you had mentioned just a minute ago, is that yes, right? So yes, we do see that there is overall decrease in suicide. And then when we disaggregate that and we see and we pull out some of those things or some of the actual different demographics, then we see that it's race, or there's a difference in racial, between racial groups. And then I'd like to point out that again, kids with disabilities or disabled kids weren't even considered in this at all.
Is it just me, or did Alicia
No,
freeze for everyone?
Yeah.
Rose. Well, we'll see if she clicks back on. Does anyone else have commentary on the vision conversation or next steps for Christy? Not Christy's next steps, but next steps that Christy can document and we can all work on together.
Yeah, I think particularly if you have, phrases of 3 to 5 words that you think capture kind of some of the themes that came out today, right? Again, this is supposed to be a pretty succinct statement, so there's a challenge, right? In getting it right. But if you have particular phrases in mind, words in mind that you'd like to see in the vision statement, please do pass those along.
I guess I would just like really quickly just say like I agree with Sonia in that like the being explicit, right, and targeted universalism is important, and we can also demonstrate that by supporting those who have been marginalized, it will actually improve the system for everyone. Like it does not leave anyone behind, and outcomes get better for all. And so because my concern is that in some spaces that will be then like that, it will maybe divide, right? Or you'll get resistance in certain spaces, especially, sometimes in legislative spaces, that sort of thing. And so I think we can make a clear case for why this helps everyone by targeting those who have been marginalized historically. So.
Targeting strategies that work for those who have been marginalized. Let's not target the marginalized people themselves.
Sorry, did I misspeak?
No, you did not misspeak in general terms. It's just one of those sort of like language things that I think a lot about, like how we use words sometimes sounds.
Yeah, sorry. Thank you for cleaning that up. Appreciate that.
Yeah. Is Alicia back with us? I haven't seen her come back into the room.
I just got a text from Alicia saying they just lost power where she lives. So if she finishes her thought through text, I will let you all know.
Thanks,
Awesome.
Charlene.
Thanks, Charlene.
Okay. Thank you all very much. If you have like specific vision statements or pieces of vision statements that you really like and articulate these things well, like Sonia, thank you so much, suggested looking at the GARE communication tool. I've looked at other states' system of care vision statements as well. So we'll try and bring something together that sums this up. Okay. Thanks, Anna.
Thanks, Christy. Really important work. And Adam, I think it's you on the presenter's agenda.
Yes.
It's me.
No, actually, I think this is me just because we had a missing spot in the agenda. So we talked a lot about the committees that we have running internally and led by the System of Care Advisory Council. But there are also a lot of other opportunities for us to engage in things that are happening outside of our leadership specifically. And so there are some member engagement opportunities coming up. And Christy and Anna are going to share with us some more specifics about that.
And Christy, we are starting with the YDO convenings, and that is your passion point. So tell us why everybody on council should find the convening nearest them and attend in person.
Yeah, happy to. And I don't know if Brian is still around, but would invite him to share out more as well. So Youth Development Oregon is an important partner in our system of care work. They are regular participants in our subcommittees. And I think as Anna and Jolene and I have kind of, come into this role and the work of the council a little bit more, we have began to see a stronger overlap in the Venn diagram of System of Care and Youth Development Oregon. If you're not familiar with Youth Development Oregon, they put out funding to communities. Their purpose is really around engaging youth who have dropped out of school, have kind of left the K through 12 education system, trying to identify those young people, bring them back in, whether it be back into a public school setting or providing access to GED or other vocational training, and then kind of providing them a pathway into employment. So in terms of like the young people that we are trying to serve here within the System of Care and YDO and kind of the barriers that YDO faces, like there's a lot of overlap. So YDO is putting on a series of in-person meetings across the state, and we said, hey, we want to be there. So we are kind of in partnership going to be attending these regional convenings. We're also encouraging our local System of Care partners to participate and play an active role. a primary objective of this particular convening that's happening in October, and this is really directly from the needs that YDO grantees have expressed, is around really trying to better understand the available supports and services about for young people who have behavioral health needs in their particular parts of the state. So there are 4 convenings, one in Eugene, one in Medford, one in Bend, one in Portland. If you live in any of those areas or can travel to them with ease and are curious and attending any of these convenings, the registration links are there. We really encourage you all to attend and participate. Joylene and I are going to be stepping into, I think we identified we'll be able to attend the Eugene, Bend, and Portland convenings. So if anybody in Southern Oregon wants to attend the Medford convening, that would be great. Either just to kind of be a support and partner with and learn more about the work that's happening through Youth Development Oregon. So if there's any questions, I probably cannot answer them, but I'm happy to carry them to YDO staff. Make sure you get an answer.
This is also a place where, we've heard sort of that partnership with schools has been challenging, and Youth Development Oregon is a division of the Oregon Department of Education. So in spaces where we want to improve those connections between service providers and schools, where we want to really focus on supports for kids, to Annette's point earlier, kids getting pushed out of the school system. Youth Development Oregon is that sort of their prime focus, is kids who have been pushed out, how to re-engage them, what needs to change. So there's I think awesome opportunity for overlap and engagement in these spaces, and then also sometimes just breathing the same air and seeing the below the shoulders of the other humans who are doing this work can be motivating and help us be more creative in how we can connect and collaborate than we do when we're just in little boxes online. So if you can attend, that would be great. Unfortunately, we cannot sponsor travel for this. Administratively, it's a whole issue. If there is a barrier for you attending that is financial in nature, please reach out to me and we'll see if there's a way we can figure out how to get around it together. Any other questions or comments on Youth Development Oregon convenings?
Can I bring a staff member with me?
Yeah, man.
Cool.
Integrate.
So Anna, just so I understand, this is an offshoot of ODE?
Yeah, Youth Development Oregon is a division of Oregon Department of Education.
And it's all focused on transition-aged youth?
Oh, Brian's making a face at me. I said something wrong. They focus on re-engaging youth in education. And they have some other stuff that they are also statutorily responsible for. Like, I think one of the things that they're responsible for, Brian, correct me if I'm wrong, is like education criteria for youth who are incarcerated. Something that they also have a hand in.
Yeah, Brian, tell us.
Tell us what you do.
No need to type it in. Just tell us.
Oh, okay. Yeah, I appreciate the shout out. Appreciate the inclusion of the convenings. Yeah, Youth Development Oregon is technically independent, although our budget sits in the Oregon Department of Education budget. But yeah, these convenings are around our work in re-engagement, which is, as has been described and explained, helping to reconnect youth. Anderson, you're welcome to bring staff. I know that you've have dollars and grants from some of our grant programs, and yeah, there's a helping young people who've become disconnected and are touching various systems, foster care, juvenile justice, etc. are kind of all the kind of youth that our dollars are supporting. So you guys, you're hitting it.
Emily Cooper.
My question's for Brian. Brian, are any of these education efforts also around special education? Like, should I let some of the folks in my office who focus more on special education efforts maybe come to these events, or is it more for youth?
The attendees tend to be our either grantees of ours in our various grant programs and their staff people, leaders, stakeholders, and also education partners. And then we do strongly encourage youth and young adults, other family members with lived experience, lived expertise to attend who've touched youth serving systems. So I'll answer it that way.
Excellent. Any other questions for Brian while we have him on the hook? Oh, man. All right. Well, if you can go, we would love to try to facilitate a broader connection between their work and our work. And Christy has a lot more information about the overlap or the Venn diagram of Youth Development Oregon and SOCAC's work. So if you have questions about that more broadly than just the convening, let us know. Another opportunity to get involved that I want to highlight for you all is the Oregon Advocacy Commission's health equity teams. We have talked a number of times in this space about equity being a particular challenge and strategies. Like, okay, we talk about equity, great, it's words on paper, but what are we actually doing practically within our systems and our structures to change the way that power is shared, that funds are distributed, that people have access to flexibility in terms of how they can invest or engage with the system. So Oregon Advocacy Commission is putting together some health equity teams. You may nominate yourself or you may nominate someone else. The work is to propose policy changes that address racism as a social determinant of health. They're weekly or bi-weekly meetings for about 6 meetings. So for a few weeks or a few months, depending on how frequently you end up meeting. And they're going to kind of be flexible based on the progress and the needs of each different group. They're going to pay $74.99 per meeting for eligible people. Eligible people are not employed in full-time public service. And they may also have an income limit. They didn't articulate that in the recruitment information. And they're looking to put together 3 teams, one around community justice, one around education, and one around healthcare. So I just felt like there was a direct connection between that work and the conversations that we have here around actually operationalizing equity strategies and making some real clear recommendations to different systems that are involved in community justice, education, and healthcare about what specifically should be changed. So I will paste the nomination form link in the chat. Whoops. And does anyone have questions about that? Nominations are due September 4th, so that is only tomorrow. I apologize for the timing on that. You have 1 day. And seeing no questions on that, I can say Oregon Advocacy Commissions are some of my favorite folks and they do excellent work. So huge endorsement. The drug endangered children training that we were funded for in House Bill 5204 in the 2024 session, the first training for that, first in-person training will be October 29th and 30th from 8 a.m. to 4:30 p.m. I think the second day actually ends at 4. The training is free, breakfast and lunch are free. Getting to and from Salem and staying the night in Salem is not free. Do with that what you will. The intent is to bring together all sorts of system partners, child welfare, law enforcement, education, judges in the court system, all of the folks who have a hand in serving and supporting children when addiction or drug use comes into their life, whether that's through surviving in a community where drug addiction is common, whether that's parents who are struggling with addiction and young people needing additional levels of support, kids needing treatment, right? All of the things that affect children when it comes to substance use and misuse. Really talking about whose role is what within the system. Are there gaps with services or supports that we need to be filling? The hope is that after these 6 statewide trainings, we will have some clear understanding of how multidisciplinary teams and other systems can be better able to support drug endangered children, to keep them out of restrictive services and stop them from having to end up in a child welfare or youth authority custody in order to get care. There are 5 more trainings coming around the state. This contract has actually been handed over to Oregon's Oregon Health Authority's Child and Family Behavioral Health team to pull off the remaining 5 trainings. So this one, Corinna and I and the contractors pulled together, but we don't have the staff capacity to get this work done, and we don't have the ability to enter into contracts to get the work done. So Child and Family Behavioral Health is graciously stepping in and taking it over. Yes, Sandra. And I will send it out in an email, and there also is a registration flyer, which has all of the information, which will load as a PDF if you click on that link. Any questions about drug endangered children training in Salem? Okay. And that is it for member engagement opportunities. Whoops. And now, Ms. Annette, the final portion of our agenda.
All right, final portion here. Housekeeping and announcements. We have some announcements from our partners and staff. First, Christiana Rhodes from OHA's Child and Family Behavioral Health team is here with a 10-minute update on the wraparound program. Christiana?
Hi, everybody. Welcome. Thanks for having me. I have a PowerPoint presentation. It's very brief, but I just would like to share that if I can make it work. So I'd like to see if I can do that. Is that okay, Anna? Oh, it says I won't. It says I can't do that.
Yeah, I'm making you co-host. Sorry,
Okay,
I'm just trying to manage 6 different things at one time.
No problem. I wasn't going to do this, but I had a QR code to share and I couldn't figure out how to share it outside of that. So just wanted to be able to do that. Okay, you should be able to see my screen there with Fidelity Wraparound Community Engagement and Feedback. Is that what you're seeing? Perfect, thanks. And I can still see some of your faces, so that's wonderful. So I just wanted to kind of update everybody on what we're doing in the world of wraparound with Oregon Health Authority and the Child and Family Behavioral Health team. I have been in my position just at about a year, and one of my big goals was to get to know the wraparound community in general and build those relationships between our wraparound partners and communities. And so one of the purposes of this community engagement was for me to do that so that I could begin to identify the strengths and also any barriers in certain areas, whether they be regional or program specific. And also for community engagement to consider changes to support Fidelity Wraparound. So this sort of started in April. My first program visit in person was in Clackamas County, and we started with these 3 community engagement questions that follow our greater community engagement process through Child and Family Behavioral Health. And those questions are: what is going well with wraparound? What can go better with wraparound? And if you could change 2 things in wraparound, what would they be? So those are the 3 questions that we asked. I'll move forward. So far with wraparound community engagement, I have done 3 community care organization regional specific meetings. I've had 9 program specific meetings. And then we had specific groups that we offered folks to attend. So like wraparound coaches and supervisors had a space to provide feedback. Wraparound care coordinators had a space. Youth peers, family support specialists, community care organization behavioral health directors, and then community mental health directors, and then Oregon Family Support Network. And then upcoming, I'm going to meet with Youth Era. And then I also have a time set aside to meet with the Oregon Department of Human Services, Child Welfare, statewide program managers, and then community care organization, another regional collaboration where the region wanted to kind kind of come back and look at the themes that were presented across the region versus in their individual programs. And then we also hosted some opportunities for youth and family members to engage in the process. But I will say we had very limited participation, and this is an area that I would hope to be able to gain more feedback in. And so this was one of the reasons that we went ahead and developed the QR code in hopes that this might be more easily accessible for folks. I know it's hard sometimes to come to a meeting if you're, if you have your child at home and you're trying to cook dinner and also show up for a meeting. And so this is just another avenue in order to kind of gain some additional feedback. And so this is the QR code, and I do have this kind of separate, and so we can try to get that to you all, and then you could use it yourselves if you wanted to provide comment or feedback, or you could share that with anyone in your network or any youth and family members that you that have been in wraparound. So I really would like to hear from those folks who have participated in wraparound or have exited wraparound, or maybe even those that had experiences trying to access wraparound and weren't able to for some reason. So anyone is welcome to use this QR code to provide additional feedback. So I'll give y'all just a minute to, yes, thanks, Alicia. I see your chat. And yes, I think if we can attach this to the notes perhaps that go out, yeah, we can certainly get that to folks. Okay. So moving forward, this is just a very general list of some themes that have come out. It's not exhaustive, but we have had feedback around administrative burden, role clarity between just different positions, whether it be the wraparound care coordinator or, system partners understanding of what wraparound is. It could be between the roles of like the youth peer, the family support specialist, and the wraparound coordinator, for example. It also included role clarity when you have transitions in and out of, higher levels of care, for instance. There was some conversation around crisis and safety planning and also how role clarity comes into play for that, as well as family members often are confused of who to call, for example, when they're in a time of crisis. Training and supervision needs were discussed, gaps in care for fee-for-service wraparound, as well as the rate, the payment models, and the billing structure. And then just differences in programs, and also that transition from one program to another or one region to another if someone in wraparound needed to transfer wraparound between programs. We did have some specific conversations that came out regarding specific rules. Some of those were related to the ratio of care coordinators to serving youth and families, for example, rules around the coaching rules and the 2-year requirement. And then a lot of information regarding the alignment between the System of Care Institute at Portland State University, who does our training, and then the messaging with OHA. How can we better align the messaging? And some of that is related to, the rules being kind of black and white, and then the principles of wraparound being kind of different than the OARs. And then there was a lot of conversation as well regarding the peer workforce, and I'll be sharing that, and I have shared with our Office of Recovery and Resilience. So again, this is not exhaustive, but this is just a quick snapshot of some of the things that we have heard from folks during this community engagement process. Yes. Emily, you have a question?
Yeah, how does this, I understand the concept of wraparound, but how does this fit in with the intensive in-home behavioral health treatment? Is this a subset, or I'm just trying to figure out where this fits in with OHA's treatment services?
Yeah, absolutely. So IIBHT, as you mentioned, and wraparound are both housed under Child and Family Behavioral Health, and they are two separate things. They do have some similarities in regard to like the team structure and the peer piece, for example. And so one of the things that we're doing is working together internally and also with some of our partners, for example, Oregon Family Support Network, to talk about potential rule changes so we can better help the community kind of understand those differences because of that overlap. So they are two very different things. Wraparound is a planning process. However, it's billed sort of as a behavioral health service, and it does require a mental health assessment in order to access at this time. But yes, we are trying to shore that up in rule and have conversations amongst one another to help the community with that. I hope that answers your question. Okay, great. Thank you so much. Any other brief questions? I know we're almost out of time. I just wanted to provide that space. So real quick, next steps, we're going to complete community engagement hopefully by the end of September. As I mentioned, I have a couple of other community engagement opportunities coming up. And then we're going to have that additional push for community engagement by youth and family members who have been involved in wraparound or any of the other scenarios I mentioned. And then anyone else who has not had the opportunity to share feedback. And then those themes will be reviewed internally and then through regular meeting that we have between OHA, the community care organizations, the mental health program staff, and then SOCAC representatives. And so we'll have kind of a subgroup that will be looking at those themes and considering next steps. And then, as I mentioned, we'll be coordinating with the intensive in-home behavioral health treatment, Office of Recovery and Resilience regarding those peer rule sets, and any other areas that we need to consider so that we can align things. And then eventually we'll move to like the formal rules advisory committee. And then we'll have opportunity again for people to weigh in about any very specific changes that come out of that process. And then I just went ahead and put the QR code here again, along with my contact information. And so if folks want to reach out directly or have questions, feel free to do that as well.
Thank you, Christiana.
You're welcome. Thanks for having me. Happy to
All
share.
right. Thank you.
And Christiana, if you can email me your slides, we'll make sure they get sent out to the council.
I sure will. Thanks, Anna.
Thanks so much.
Mm-hmm.
Now we have Christy with the 5-minute presentation.
Is this just about the membership?
Yes,
Survey,
sorry.
Anna? Okay. Yeah, so just a friendly reminder that we are trying to confirm membership on all of our committees. So there is a survey that we have sent out. You should have seen it. If you have not yet seen it and have no idea what I'm talking about, please let me or Corinna know. We're sharing this with all appointed members. We're also sharing it with everyone who has ever expressed interest in any subcommittee, trying to get to a firm roster for each of those committees that is no bigger than 25 people. So hopefully we'll have this all wrapped up by end of September. So I think if you have not responded, Corinna's probably going to be reaching out and pestering you to make sure we've got your interest and commitments noted.
Brenda might be reaching out anyways. We have enough people who have multiple email addresses on multiple calendar invitations that it's really hard to be sure that we haven't already pestered you. So if you have gotten the email and you were a good council member and you got in there and you filled out your information and you're like, I'm done, then you can just gleefully delete any future emails you get about that topic. But I can't guarantee you won't be getting a little bit spammed as we try to make sure we're not missing anybody. We don't want to miss somebody who was on vacation or somebody who's started using a new email address, but we have their old one on one of our invites. But I will say part of the urgency of this is that we are now at a point where some of our calendar invitations cannot be sent because so many people have asked to get added and added and added to those invitations that they are now too large for Outlook to actually send them out. And I don't know who to take off. And I know if we just go in and start removing people, it's going to be the wrong people, or I just want to make sure that if you want to be there, you're telling us you want to be there, we'll keep you on the list. This is not a black and white. If you don't fill it out and you get removed from an invitation, you can always say, I want to be there, and we'll put you back on. So it's not a threat. It's not intended to offend anyone. It really is just an administrative task that needs to be done so that Outlook will work with us and send out invitations to you all. And finally, I think that's it for membership. Yeah, Christy? Okay, I'll stop talking.
And now we have some local system of care coordinators. in the room to share any updates that are going on, including celebrations, challenges, brags, whatever they want to bring. So if you guys just want to raise your hand and step to the mic. Do we have anyone here?
Hi, Lucy.
Hi. I'm kind of waiting to see if anybody else wants to say anything, but we've had a busy summer. And I know 2 of the SOCs will be presenting at the CCO conference in October. So we're really excited about that. We'll be presenting on respite services, and the Multnomah SOC will be presenting on AGEL funding. So we're really trying to spread some of the work we've been doing. So that's pretty exciting. But we've also been very busy working with our school systems, focused on behavioral health issues for special education teachers. We're looking for more training and more coordination there. So we've been pretty busy summer, not what we thought it would be, but it's good. It's good to be busy.
Thank you.
Hi, I can step in real quick. I'm Tracy from Jackson County down here in Southern Oregon, and we just had our we have in-person meetings twice a year now. We just finished up with one last week. We had 75 people, youth and family members, and OHA came down and talked, and it was just a really great meeting, and really realized how important it is to be in person. I think our group really wants to be in person more, so that's something we're contemplating. And we've, as Lucy said, we've been super busy too with all of our trying to get our grant funds together and get contracts out, and just really great things happening down here. So thank you.
Thank you. All right. Thank you, Lucy and Tracy. So I'm going to turn it over now to Adam.
Yeah. Well, it's time to close up shop a little early, it looks like, folks. So thank you. And then just I'll note Emily Cooper in the chat. The Wyatt Fairness hearing is next Thursday in Eugene. That's related to child welfare and the settlement that they've reached. So I know that they would love folks to come and be a part of that. Thanks for joining us. Our next meeting is October 1st, also via Zoom. Keep an eye on your email for agenda updates and materials. You can, of course, always connect with Anna if you have topics you want to see on a future agenda. And with that, thank you all for your time, and I'm sure I'll see you all in a subcommittee very, very soon. So stay cool, everybody. Last heat wave of the summer coming up. So take care of yourselves.